1, 2, 3, 4.
Sorry. Muchas gracias, señora ministra. Good morning, everyone. Bienvenidas a todas. Comenzamos esta jornada de First Cluster Meeting and Capacity Building Workshop for You Instruments con unas palabras de bienvenida de la ministra de Sanidad del Gobierno de España, Mónica García.
Bueno, muy buenos días a todos y todas. Good morning. You are so very welcome. Es un placer y un honor inaugurar este encuentro. Durante los próximos 2 días este lugar va a ser y se va a convertir en un punto de encuentro de instituciones, de países y de miradas diversas que tenéis una misma preocupación y una misma responsabilidad, y es cómo reforzamos nuestros sistemas de salud en un momento que es decisivo para Europa. Hoy confluyen aquí actores de enorme relevancia: la Comisión Europea, la Organización Mundial de la Salud, el Observatorio Europeo de Sistemas de Salud, el Ministerio de Salud de Italia, personas expertas procedentes de Austria, Bélgica, Estonia y Eslovenia y, por supuesto, las comunidades autónomas españolas junto a las diferentes direcciones de este ministerio. A todas y a todos, en nombre del Gobierno de España, os damos la más calurosa bienvenida a este Ministerio de Sanidad. Nos esperan días que son intensos, de trabajo, de intercambio y de reflexión compartida. Días pensados para avanzar en un objetivo que es muy concreto y muy necesario, que es mejorar la identificación, la coordinación y la gestión de los fondos europeos aplicables a nuestros sistemas de salud, y hacerlo además reforzando la cooperación entre las administraciones nacionales, regionales y europeas. Este objetivo cobra hoy una relevancia especial porque Europa es más necesaria que nunca y, al mismo tiempo, resulta imprescindible fortalecer nuestros sistemas nacionales de salud, en donde la Unión Europea cuenta actualmente con distintos programas e iniciativas en materia de salud que han permitido avances muy importantes: una mayor protección de la salud de la ciudadanía, una mejor preparación frente a futuras pandemias y un refuerzo progresivo de la resiliencia de los sistemas sanitarios europeos. Son avances que son fundamentales y, aún así, el momento que vivimos nos invita todavía a ampliar más nuestra mirada. La Carta de los Derechos Fundamentales de la Unión Europea consagra el derecho a un alto nivel de protección de la salud y llama a reforzar las estructuras y los mecanismos que permitan mejorar la prevención, la preparación y la respuesta frente a los riesgos para la salud humana. Para que estos derechos sean simplemente efectivos, necesitan apoyarse en instrumentos que sean sólidos, en capacidades que sean compartidas y en una cooperación real entre los diferentes países. De ahí la importancia de avanzar hacia un marco más robusto de cooperación transfronteriza frente a las amenazas para la salud. Un marco que permita proteger mejor las vidas, sostener los derechos humanos y preservar las libertades y los derechos civiles, elementos inseparables del proyecto europeo y de nuestra concepción democrática. Vivimos un momento internacional que es complejo, marcado por incertidumbres, por crisis que se superponen y por riesgos que hace poco pudieran parecer lejanos, pero que hoy ya están aquí. Pero también es un momento lleno de oportunidades que no podemos dejar pasar. Y en este contexto, la Unión Europea tiene un papel decisivo: el de sumar esfuerzos, el de coordinar respuestas, el de reforzar la cooperación internacional y el de contribuir de manera real a una mayor seguridad sanitaria a escala global. Conviene recordar que el modelo social europeo ha sido durante décadas una fuente de estabilidad y una fuente de bienestar. Y dentro de este modelo, los sistemas nacionales de salud han constituido uno de los pilares esenciales junto a la educación y los derechos sociales y laborales. La pandemia puso a prueba nuestros sistemas sanitarios hasta el límite y evidenció tanto su fortaleza como la necesidad de seguir reforzándolos. Por eso, cuando hablamos de dar un paso más, lo hacemos a la vez desde la experiencia y desde la convicción. Tenemos ante nosotros la oportunidad de empezar a pensar y a construir las bases de un futuro sistema de salud común europeo. Un proyecto capaz de reducir la incertidumbre, de proteger mejor la ciudadanía y de reforzar el propio proyecto europeo en sí mismo. Este camino exige, además, una visión integral. Las políticas de salud necesitan dialogar con otras políticas públicas que aborden los problemas sociales desde las diferentes perspectivas. Como recuerda la economista Mariana Mazzucato, muchas de las grandes misiones sanitarias solo pueden abordarse si actuamos desde los factores sociales y desde los factores económicos que están en el origen de la desigualdad, lo que conocemos como los determinantes sociales de la salud. Hablamos de cuestiones tan concretas como el empleo, como la vivienda, como la educación. Y en este marco se sitúa la decisión del Ministerio de Sanidad de crear un grupo de trabajo centrado en la creación de valor público a partir de una participación más estratégica y coordinada junto a las comunidades autónomas en los planes y programas promovidos por la Unión Europea. Instrumentos como el EU for Health, los fondos FEDER, el Fondo Social Europeo, los fondos Next Generation han tenido un impacto muy positivo en la mejora de los sistemas de salud y en España conocemos muy bien ese valor. Mirando al futuro, avanzar hacia un sistema de salud común europeo implica asumir un compromiso y una ambición que son mayores. Significa entender la salud como parte del ADN de Europa. Significa pensar también nuestros barrios, pensar nuestras ciudades como espacios saludables, sostenibles, cohesionados, integrando lo social, lo económico y lo ecológico en una misma visión de bienestar. Sé que estas cuestiones van a estar muy presentes en los trabajos de los próximos días y que el Observatorio Europeo de Sistemas de Salud contribuirá a extraer conclusiones valiosas. Quiero terminar agradeciendo de manera muy especial a la Comisión Europea, a la Organización Mundial de la Salud, al Observatorio Europeo de Sistemas de Salud por hacer posible este encuentro, también, como no, a las comunidades autónomas, a los centros de investigación, a los distintos equipos del Ministerio de Sanidad, al Ministerio de Salud de Italia y a las personas expertas en los distintos países que vais a compartir hoy experiencias, aprendizajes y buenas prácticas. El proyecto TSI ofrece una oportunidad para mejorar los mecanismos de planificación y de gestión de los fondos europeos y también para reforzar alianzas, generar confianza y consolidar una forma de trabajo basada en la cooperación y el aprendizaje mutuo. Desde el Ministerio de Sanidad creemos firmemente en el multilateralismo y en la fuerza de estas alianzas y nuestro compromiso con la Comisión Europea y con la Organización Mundial de la Salud es claro y forma parte de nuestra acción cotidiana en los foros internacionales. Confiamos en que este encuentro sea útil, productivo y estimulante y que contribuya a avanzar hacia un trabajo conjunto que sea más ágil y coordinado. Os deseo que tengáis unas jornadas de trabajo fructíferas y nuevamente os doy la más calurosa bienvenida al Ministerio de Sanidad. Muchas gracias.
A continuación, tendrán la palabra para presentar el encuentro las distintas instituciones organizadoras del encuentro. Por favor, compañeros. Sí. En primer lugar, tendrá la palabra Dimitra Pantelli, responsable de programas del Observatorio Europeo de Sistemas y Políticas de Salud.
Thank you very much, Pedro. Thank you very much, Minister. Thank you very much, Eloy, and everyone at the Spanish Ministry of Health for hosting us here today and tomorrow. My name is Dimitra Pantelli. I lead the work on innovation for the European Observatory on Health Systems and Policies, and it has been our pleasure and our honor to co-organize this event here with the Spanish Ministry of Health. This is why I also have the privilege of addressing you after the Minister and trying to reflect on what our role is as the Observatory and what we expect and what we hope for the 2 days ahead of us here. So we at the European Observatory on Health Systems and Policies are a partnership. The partnership is hosted by WHO Europe, includes international partners like the European Commission, a number of regional governments, including the one in Spain, and also the regional government of Veneto in Italy and Agenas. So we are very happy to have all of our partners represented here. And our work is to be knowledge brokers, is to bridge the gap between what we know about how health systems can change, improve, and strengthen, and what decisions are taken and how they are implemented. And in our experience in the last 25 years and more, we have learned that health systems can learn a lot from each other. The Minister just talked about this. Some different challenges, some same challenges, but a lot of experience and a lot of very valuable knowledge that lies within your everyday practice that we can bring together to be stronger as we move forward into the future and to address, of course, the increasing challenges that health systems face today. Very importantly for these 2 days, this idea of knowledge exchange in the area of how the EU can support its member states in strengthening their health systems and how to better navigate the environment of the different types of support that the EU provides. The experience that what we hope to bring to the table in this workshop in this project is based on experience that we have collected before in a previous project under the technical support instrument of the European Commission. My colleague Simone will talk about that in a minute, where we thought about this idea of the EU Health Hub, which is the flagship under which this project takes place, where the idea really is to understand better what the options are for member states to make use of the multifaceted support that the EU provides. During the day today, we will talk about what that looks like, and we will exchange experiences not only between our Italian and Spanish partners who are here, but also learn from experts from the previous initiatives. As the minister said, we have Austria, Belgium, Slovenia here. We have additional international experts that bring experience from Estonia and other countries, with navigating the complex landscape of EU support, and with successes and challenges in doing so. And in particular, of course, in complicated systems where different levels of governance need to work together, for that to work as smoothly as possible, we need to think about additional considerations, and everyone in the room today has their own experience that they bring to the table in order for that to happen. So from our perspective, what's really important is to use the 2 days, today more on getting into the discussion of how that can work and what the options are, and then tomorrow to go more in depth into the projects that are interesting and important for Spain and Italy moving forward with addressing the health systems challenges that they face, and to use it really as a workshop opportunity, as the name of the event signifies. So our hope is that we won't spend 2 days just listening to presentations or to silence in the room, but people will really feel comfortable to bring in their own experience, their own questions, and treat it like it's an opportunity to learn and advance together and strengthen our collaboration. And I think with that, I will pass over to Pedro. Yes, thank you.
Thank you very much, Dimitra. A continuación tendrá la palabra Simone Boselli, que es responsable de políticas para las reformas sanitarias de la Comisión Europea.
Muchas gracias, Pedro, estimada ministra, Eloy, Dimitra, Thomas, Mariella. Thank you very much for having me here. My name is Simone Boselli. I represent the Task Force on Reform and Investment at the European Commission, and allow me to spend a few minutes to first and foremost welcome you here today. I'm really looking forward to this cooperation between two countries that, one, Italy is very dear to my heart because I was born there, so it's really important to me, but also because from their set up at a regional level in how health is delivered, their history in the national health services, their progress are two very important countries in Europe. And the word of the minister were very much appreciated in the terms of the work that we are doing in Brussels. When we speak about EU investment in health, attention focuses, rightly so, on funding programs that are much larger in nature as compared to what I represent, the technical support instrument. But what ultimately transforms health system is capacity, is governance, and the ability to design and implement complex structural change when we talk about reform. And that's where the TSI plays a critical role. Across Europe, health systems are under structural pressure. We face demographic aging, workforce shortages, rising chronic diseases, mental health needs, and so on and so forth, not to forget about the impact of COVID-19 and preparing for the next pandemics. They are not issues that can be solved in isolated projects. They require system-level reform in financing model, service organization, digital infrastructure, workforce planning, governance, and prevention strategy. Over the recent year, the TSI health-related project, including the first version of what we call the EU Health Hub, where we have representatives from Austria, Belgium, and Slovenia, talking today about their experiences in navigating the complex funding system at European level. We have tackled all of these areas, and even in Spain, in integrated care, for example, in the Basque countries, we have supported also Catalonia in their upskilling of healthcare workers in the digital transformation, and so on and so forth. A key strength of the TSI is that it is demand-driven, and clearly member states request support based on their reform priorities. This ensures ownership at national level, while EU-funded expertise, and here I thank colleagues at the Observatory and the WHO for their expertise and support, brings comparative experience and best practices from across Europe. In this way, the TSI functions as a bridge between EU policy and national implementation. It complements investment tools like cohesion policy, recovery and resilience facility, which is coming to an end this year, helping the TSI member states, prepare the ground in the design of the reforms, strengthening of administrative capacity, and I'm really glad to see so many people from the regions, both from Spain and Italy, here today. In the context of the forthcoming EU budget cycle and evolving financial architecture, this enabling function remains very important. A funding stream become more integrated and performance-oriented, member states will need strong institutional capacity to plan, coordinate, and monitor complex health reform. With this, I would like to wish you a very good day. As Dimitri said, please be curious and be willing to exchange views with colleagues from the other side of the Mediterranean Sea, very, very close to you, and also other member states that have gone through this project before. Thank you very much, Eloy, for welcoming me here, and I hope we will have a very productive 2 days. I remain here to try to speak a little bit later about the next MFF, as much as I can say, but I look forward to the exchanges in between and during the next session. Thank you very much.
Muchas gracias, Simone. A continuación tiene la palabra Eloy Cuellar, subdirector de Planificación y Fondos Europeos del Ministerio de Sanidad de España.
Gracias, Pedro. Muchas gracias. Lo primero, pues, dar las gracias por la organización del encuentro en el que vamos a compartir conocimiento durante 2 días. En primer lugar, a nuestra ministra de Sanidad, Mónica García, a la Comisión Europea, que ha estado presente, Simón, animando y ayudando desde el primer momento para que pues sea posible no solamente el encuentro, sino todos los trabajos previos que llevamos haciendo. A la Organización Mundial de la Salud, Tomás Zapata, muchísimas gracias por estar presente. Por supuesto, al Grupo de Trabajo para la Reforma y la Inversión de la Unión Europea, digo que en este caso ha estado financiando también el encuentro, que también es muy importante. Dimitra Pantelli, del Observatorio Europeo de Sistemas de Políticas de Salud, gracias, porque vamos a aprender un montón juntos. Y Mariela Meinhof, del Ministerio de Sanidad de Italia, que va a tener una presencia destacada y a quienes agradecemos que se animen a compartir conocimiento. Yo simplemente quiero primero aprovechar para subrayar la importancia de que en este encuentro tratemos de poner en común aquello que nos está saliendo bien, las buenas prácticas en nuestros sistemas de salud. Y nosotros, desde el Ministerio de Sanidad, nuestra posición va a ser aprender un montón, pero también contar algunas de las cosas que estamos haciendo. Y hago un pequeño avance que simplemente pretende subrayar, cuál es la sistemática. Y doy una primera buena noticia, ¿no? El Ministerio de Sanidad tiene una estrategia para transformar y para consolidar el Sistema Nacional de Salud. Y en esa estrategia los fondos europeos son importantes y eso ha tenido un reflejo muy importante en nuestra organización, poniendo de alguna manera o situando los fondos europeos en un lugar central. Aprovecho para saludar a nuestra subsecretaria, que es donde estamos ahora mismo trabajando en la subsecretaría de los fondos europeos. Eso significa que se le ha dado una importancia notable. Y decía que tenemos una estrategia en el Ministerio de Sanidad y doy algunos de los avanzo algunos de los mensajes que queremos compartir, ¿no? Por una parte, una estrategia no sería nada si no hubiera un sistema de planificación. Y para nosotros ha sido importante arrancar, de alguna manera, una cultura de planificación en el Ministerio, implantarla en estos años a través de un plan de legislatura, un plan de gobierno que pretende sistematizar la acción pública, convertir el conocimiento en acción, porque muchas veces las ideas, si no se convierten en actuaciones concretas, pues se pueden quedar ahí. Y ante ese riesgo, lo que hemos hecho es, para convertir ese conocimiento en acción, tener un plan que habla de recuperar el orgullo de la sanidad pública, de adaptar la sanidad al siglo XXI, de ensanchar el Sistema Nacional de Salud y de fortalecer el Ministerio de Sanidad, porque la herramienta que nos hemos dotado las sociedades, en este caso el Ministerio de Sanidad, es una herramienta de la que se ha dotado la sociedad española, es un instrumento para profundizar, para ensanchar, para mantener, para consolidar un sistema nacional de salud en el que participan activamente, y aprovecho para saludar también a quienes nos están siguiendo online y a quienes están aquí presentes, el esfuerzo que han hecho las comunidades autónomas. Han hecho un esfuerzo para tener una enorme presencia en este encuentro, han participado habitualmente en la ponencia de proyectos europeos que les ha sugerido el Ministerio de Sanidad. Yo quiero agradecer pues en todo momento sus aportaciones técnicas y quiero agradecer, digo, también esa concepción del Sistema Nacional de Salud como algo que nos involucra a todos. Decíamos que era importante la planificación para materializar una estrategia, pero tan importante como la planificación es también una buena gobernanza. Y hemos querido que esa gobernanza en el Ministerio de Sanidad, y tendremos ocasión de desarrollarlo en los trabajos con el Observatorio, con la Comisión, con la OMS, hemos querido que esa gobernanza pasara desde el trabajo con la Comisión Europea, con la Organización Mundial de la Salud, hasta el trabajo con los ayuntamientos. Y voy a poner 3 ejemplos muy concretos de cómo hemos venido haciendo esto. Para empezar, se crea esa ponencia dentro del Consejo Interterritorial del Sistema Nacional de Salud, y esa ponencia de fondos europeos pone en relación las comunidades autónomas, los territorios, con las propuestas de la Comisión Europea. Nos hemos visto a distancia, pero hoy por fin vamos a podernos poner cara directamente, vamos a poder conversar, y a mí me parece muy importante que nuestras comunidades autónomas puedan también relacionarse directamente con la Comisión Europea, puedan relacionarse con el Observatorio de Políticas Sanitarias Europeo, puedan relacionarse con la Organización Mundial de la Salud y podamos también tener una relación con en este caso, con un país que está también trabajando, un país mediterráneo que también está trabajando esas políticas y que es Italia y que está hoy presente con nosotros. En ese trabajar desde el plano europeo hasta el plano local, trabajando con las comunidades autónomas, nos hemos dotado de instrumentos internos en el Ministerio de Sanidad que, bueno, pues no voy a contar más allá del propio GPS, pero hemos estado teniendo una experiencia que hemos compartido en España y que creo que merece la pena sacar conclusiones. El Plan de Recuperación, Transición y Resiliencia ha sido un ejemplo de planificación operativa, ha sido un ejemplo de cómo Europa con los fondos Next Generation es capaz de invertir en la gente, porque al final es invertir en las personas, y en este momento pues tenemos que decir que se aprobó en 2025, en diciembre de 2025, esa adenda de simplificación. Para nosotros el Plan de Recuperación, Transición y Resiliencia es un ejemplo de cómo puede trabajar la Comisión Europea con los Estados y a su vez también con las comunidades autónomas, incluso ir más allá y llegar a las entidades locales. Las repercusiones del PRTR formarán parte de la historia de la evaluación de las políticas públicas. Tendremos ocasión de evaluar esas políticas públicas dentro de unos años, pero creo que se puede avanzar, que va a ser un enorme logro para este país el haberlo llevado a cabo y, en concreto, en materia sanitaria va a ser un enorme logro. 80.000 millones en total de transferencias, 22.800 millones en préstamos. Creo que la gestión, será evaluada positivamente. Y pongo algún ejemplo, ¿no? Algún proyecto de éxito que nosotros podremos contar a lo largo de las jornadas. Por una parte, dentro del Plan de Recuperación, Transición y Resiliencia, este Ministerio ha venido impulsando el Plan INVEAT con pues la componente 18 del Plan de Recuperación. ¿Por qué es importante o por qué ha sido importante ese plan? porque no solamente lo ha impulsado este ministerio, sino que lo ha impulsado con las comunidades autónomas. Luego es un ejemplo de cooperación intergubernamental en España para poner en marcha un plan europeo. Es decir, la gobernanza europea, los grandes planes, al final, ¿en qué se plasman? Pues una inversión de más de 700.000 euros que, ejecutándose por parte de las comunidades autónomas, ha permitido incorporar sistemas de salud y equipos médicos adicionales de alta tecnología que han permitido elevar el nivel de nuestro país en cuanto a la disposición de esos equipos. Estamos hablando de salvar vidas, estamos hablando de calidad de vida y eso ha sido posible gracias a esa cooperación intergubernamental. Otro ejemplo rápido que tendremos ocasión de destacar es el proyecto Ciudades Saludables, que de alguna manera entronca con esa visión que se tiene desde el Plan Estratégico del Ministerio de Sanidad, desde el GPS, de ensanchar el Sistema Nacional de Salud y también de la concepción que yo creo que va calando en los equipos de que la salud es algo más que lo sanitario. Por eso el proyecto de Ciudades Saludables ha sido un proyecto muy interesante que se ha llevado a cabo llegando al nivel local. Es decir, que desde el ayuntamiento, desde el ministerio con las comunidades autónomas hemos llegado al nivel local. ¿Para qué? Para poner instalaciones para la realización de actividad física al aire libre, infraestructuras de fomento de la bicicleta, rutas o circuitos saludables y seguros, inversiones de alguna manera asimilables para la creación de espacios saludables, prevenir de alguna manera las consecuencias del cambio climático y actuaciones para la promoción de estilos de vida saludable. En esto último, ya les avanzo que tendremos la ocasión mañana de hacer una propuesta a todas nuestras comunidades autónomas dentro del marco de la ponencia que tenemos de fondos europeos para hacer un trabajo conjunto en materia de salud y bienestar infantil a partir del Fondo Social Europeo Plus. Digo que lo avanzo para que las comunidades autónomas que están presentes tendremos ocasión de invitaros a poner en marcha un proyecto conjunto y creo que es una buena noticia que podemos dar hoy. Y, cómo no citar los servicios digitales a la ciudadanía. Creo que son, cuando nuestra ministra hablaba de las oportunidades que se presentan, son también una oportunidad, es decir, tenemos la oportunidad que podemos aprovechar y que para aprovecharla pues, se están poniendo en marcha proyectos como la historia clínica digital, la receta electrónica, que también tendremos ocasión de compartir. Bueno, no quiero extenderme más, simplemente decir que es esta una ocasión para compartir conocimiento, para no solamente compartir conocimiento, sino de alguna manera aprovechar que nos vamos a ver personalmente para pues, trasladarnos pues, todas las inquietudes que tengamos, trasladarnos también todos los proyectos de éxito, pero en el día a día. Tenemos 2 días intensos. Muchísimas gracias a todos y a todas por estar aquí y nos vemos trabajando. Muchas gracias.
Muchas gracias, Eloy. A continuación tendrá la palabra Mariela Mainolfi, directora general del Ministerio de Salud de Italia.
Grazie, buongiorno a tutti, saluto le autorità qui presenti, il Ministro, i colleghi della Commissione europea, dell'OMS e ringrazio di questa opportunità il collega del Ministero spagnolo che ringrazio della opportunità e dell'accoglienza ed è davvero con grande piacere che noi siamo qui come Ministero della Salute italiano in una fase diciamo molto possiamo dire anche di transizione oltre che di riflessione sui temi attuali. Perché diciamo che il progetto che la Commissione europea e l'OMS ci hanno dato l'opportunità di portare avanti, e cioè il TSI sulle professioni sanitarie, è proprio un'opportunità che noi cogliamo come opportunità strategica, quello appunto di riflettere in modo strutturato e condiviso sul ruolo delle professioni sanitarie nei nostri sistemi di welfare, in una fase appunto che è caratterizzata da profonde trasformazioni comuni, e cioè quelle demografiche, quelle epidemiologiche e anche quelle organizzative. E nel nostro paese, diciamo, siamo anche in una fase molto produttiva dal punto di vista normativo, perché in Parlamento abbiamo un disegno di legge sul riordino delle professioni sanitarie e recentemente è stata approvata dal governo anche una legge delega sulla riorganizzazione del Servizio Sanitario Nazionale. Quindi abbiamo un impatto diretto sulle professioni sanitarie e indiretto per quanto riguarda l'organizzazione proprio dei sistemi sanitari. Per cui questa opportunità che le organizzazioni europee ed internazionali ci danno è per noi veramente, e anche l'osservatorio, mi scusi di non averla citata prima, però anche l'osservatorio, anzi è fondamentale l'osservatorio proprio per un elemento che abbiamo considerato importante sin dall'inizio, e cioè quello delle buone pratiche. Avere per noi diciamo, la consapevolezza di quello che accade, delle buone pratiche che già sono in uso negli altri paesi, è importante per mettere in campo delle azioni che siano utili al nostro sistema. Quindi abbiamo cercato con il TSI anche di rafforzare proprio la governance sui professionisti sanitari con le nostre regioni, quindi ringrazio il Promis che è qui presente, che assieme a tutte le regioni, al coordinamento del Veneto, ci ha dato questa opportunità, perché è chiaro che sui professionisti sanitari, visto che le problematiche sono comuni anche a tutti i paesi europei, è importante anche che si ragioni insieme e si mettano in campo delle azioni anche comuni e condivise, proprio perché abbiamo gli stessi punti di partenza, diciamo, di crisi, anche se possiamo avere sistemi organizzativi anche diversi. Però mi ha fatto piacere ascoltare anche quello che il collega diceva sull'approccio One Health che stanno mettendo in campo nell'affrontare il tema salute, e anche noi come Ministero, diciamo che dal punto di vista politico si sta anche spingendo per la prescrizione dell'attività sportiva come attività prescritta proprio dal medico in un'ottica di prevenzione. Stiamo anche noi lavorando molto sul fascicolo sanitario elettronico e tutta la sanità digitale, anche grazie al PNRR. E poi al tempo stesso c'è stato un passaggio importante anche per i cittadini in un decreto semplificazioni approvato a dicembre di quest'anno, e che prevede per i malati cronici la possibilità di avere un'unica prescrizione con validità di 1 anno, quindi il cittadino che ha appunto una malattia cronica non ha necessità di ripetere ogni mese oppure ogni 8 giorni una ricetta, ma ha una validità annuale, e quindi il farmacista poi dispensa questo farmaco anche ogni 30 giorni, questi farmaci ogni 30 giorni, quindi il farmacista entra anche in un sistema di monitoraggio dell'aderenza terapeutica, di correttezza dell'uso dei farmaci. Questo per dire che anche noi stiamo cercando di rafforzare tutta la rete dell'assistenza territoriale, e da noi c'è stato un ruolo molto forte anche delle farmacie dei servizi, che diventano anche un luogo in cui vengono effettuata appunto questo monitoraggio, quindi questa assistenza al paziente cronico, e anche la erogazione di alcune prestazioni, quindi di alcuni servizi. Avremo modo insomma di riflettere e di approfondire in questi 2 giorni anche il tema strategico dei fondi europei, quindi su questo ci aspettiamo di ascoltare le buone pratiche dei paesi che partecipano, e quindi ci auguriamo insomma che sarà un lavoro molto proficuo. Noi siamo a disposizione per mettere, diciamo, a confronto tutte le attività che sono in atto e quelle che vorremmo intraprendere. Grazie per l'ascolto e buon lavoro a tutti.
Muchas gracias, Mariela. A continuación tendrá la palabra Tomás Zapata, responsable de la Unidad de Recursos Humanos en Salud y Sistemas de Salud de la OMS Europa.
Bueno, muchísimas gracias, ministra. thank you so much to you and your team, because I think every time we come here, I think we feel at home, I would say. So I would like to strengthen and emphasize the good collaboration that WHO and the Ministry of Health have, and especially on health workforce, because I think we have been doing a lot of work in this area, and I want to take this opportunity as well to congratulate the Ministry and the Minister and the team for the signature this week with the unions of the Statuto Marco, which I think is a very good way of improving the working conditions of all health workers in Spain, which is very much needed and is very much aligned with the European WHO Framework for Action on Health and Care Workforce that Spain and Italy adopted in the Regional Committee in Astana some time ago. I would also like to thank the European Commission for the trust to WHO to be part of this partnership, and also the European Observatory, because I think we work closely so well, and of course colleagues from Spain and Italy, and also because we have a little bit of experience here from Austria, from Belgium, and from Slovenia, which I think is going to be a great opportunity, having this cluster meeting to really learn from each other, as it has been mentioned before. From Austria, Belgium, and Slovenia, because they ran this project before us, so I think we can learn from their past experience, and between Italy and Spain, because I think it's a great opportunity to see how we can cooperate, as the Minister was mentioning before. I think in a world that seems to be a lot of competition, having these spaces for cooperation, for dialogue, are so important. And we know that health systems, Mariella was mentioning from Italy, are facing huge challenges in terms of population aging, in terms of multiple chronic diseases, in terms of health workforce crisis. And I think that's why it's so important that we do an effective use of EU funds in order to support this health system reform, so that health systems are able to respond to population needs. And in that sense, this specific project, technical support instrument, I think is a great opportunity for this health hub to do three things. The first one, I think, is about improving coordination at different levels. Coordination between the local, regional, and national levels. In Spain, for example, having comunidades autónomas here is so important, but I think in Italy you have a similar situation. So coordination is the first critical element. Second is about building institutional capacity so that it's able to apply to more EU funds. They are complex funds, but it's important to understand where the different funds and how to apply to those, and also how to manage and implement effectively those funds. So I think that's the second objective. And the third one is about having one unique access for this health hub in terms of putting a governance together for improved coordination and information. So with that, just to conclude, I would say that as WHO and the whole team represented here, that I'm representing here, I think we are super happy of being part of this tripartite with the Commission, with the Observatory, working closely with Spain, working closely with Italy, to really make a difference. So I think we have a huge opportunity to use wisely these EU funds so that we are able to strengthen health systems to, at the end, improve population health, and especially for those most vulnerable. And I think that's why we are all here. So thank you so much.
Muchas gracias, Tomás. So, colleagues, if you can go to the front, we are going to take a picture with the Minister. Ministra, si puede subir para hacer la foto con los ponentes. Lo ponen eso. So, thank you very much, everybody. Okay, we will start with the first session. That's sorry. No, después.
Okay, so again, good morning, everybody. This is now the working part of the meeting that is starting. So you have realized by now this is a trilingual meeting. So there is simultaneous translation into Italian, into Spanish, and into English. So those of you who don't have a translation device yet and would like to have one, there is available ones in the back, and I would encourage you to use them so as not to miss anything that is being discussed. We have one request for you. As I said before, we really hope for this to be interactive, and we hope to discuss. And as tempting as it is to sit back and relax, we would like to try not to do that as much as possible. So I would like to ask everybody who is sitting in the back to please move forward as much as possible. We have 2 rows, empty rows of seats here in the front that are reserved for panelists that are free and are waiting for you. So I would like to ask, especially those in the very back, to please get into some exercise, a couple of steps to the front of the room, and join us here in the front so we can have more of a discussion rather than presentations that go in one direction. In this first session, which is already, I think, slightly shorter than we planned it to be. Yes, don't take this away from me, thank you. Thank you. What we're going to do is we're going to talk about the individual components of the TSI project that we're all in as a basis for everyone to understand where the 2 countries are coming from and what's important for them, before we move into the more specific discussions on different EU support tools throughout the day. Just to give us a sense of the room, can I ask all the colleagues who are here from Italy to raise their hands? All right. Yes, I know there are more of you, they're just not reacting, but okay. Very good. Hands up. Wonderful. All our colleagues who are here from Spain, raise your hands, please. Very nice. Thank you for hosting us. All the others who are in the room, including myself, who are not from the Italian health system or the Spanish health system. Excellent. And we have a couple of people online as well. So you see, from both countries, lots of people. From other contexts, also lots of people who have the chance to discuss during the sessions, but also please make use of informal time, like the coffee break, to try and talk to people who are not your direct colleagues or your office mates back home. That's part of the point of being here. All right, I think we start with Pedro, right? He'll give us some introductory and of course, to give us some introductory words on the project as a whole. Yeah, it's over to you.
¿Qué tal? Buenos días. Mi nombre es Pedro Campuzano, vengo de OMS Europa y vamos a presentar conjuntamente con Daniel Rodríguez, jefe de servicio de la Subdirección de Planificación y Fondos Europeos del Ministerio de España, un poco las distintas cuestiones relevantes del proyecto TSI en España, por qué hacemos esto, cuáles son los desafíos y las expectativas que nos estamos encontrando. Entonces, le paso la palabra a mi compañero Daniel.
Buenos días, soy Daniel Rodríguez, trabajo en la Subdirección de Fondos Europeos y que estamos ayudando a desarrollar este proyecto TSI junto con Pedro Campuzano. Bueno, voy a hacer la presentación en inglés, si no os importa. Well, in relation to the impetus of the project, we need to improve the strategic use of all the substantial EU funding opportunities for health, such as move from fragmented to strategic and planned use of all the health funds, aligning EU financing with national health priorities, and also long-term reforms, and the importance of using the EU funds as a catalyst for transformation, innovation, and system resilience. In addition, we think it's also important to leverage the best practices and also developing the potential of the health policy manager system, also known here in the ministry as GPS, as a planification tool, and also the European Funds Committee of the Interterritorial Health Council. The goal of the project will be to establish a permanent national coordination platform for all the health investments for the EU funding that could provide information, guidance, and also support.
Este proyecto es relevante y creo compartimos eso con el proyecto TSI de Italia, que tiene más de una rama, más de un brazo. Tiene uno específico que tiene que ver con la gobernanza de fondos europeos, que es el que nos ha traído hasta aquí y que, como decía Daniel, va a tener ese objetivo final de conseguir un espacio de gobernanza y ventanilla única para ayudar a gestionar de forma más eficiente, más ágil y con más claridad los fondos europeos. Y para eso va a haber una serie de distintas cuestiones que vamos a ir trabajando durante el proyecto. Algunas tienen que ver con el diagnóstico de la situación de la gestión de fondos europeos actual. Toda esta parte de encuentros, que también forma parte de la capacitación, digamos, del personal técnico, que luego tendrá que cristalizar en unas formaciones específicas a distintas personas que luego van a formar a técnicos a distintos niveles en las comunidades autónomas, en el Ministerio, en los distintos institutos de investigación, y también generar una batería de herramientas y un toolkit que nos ayude a tener esas herramientas, ¿no? Y hay una cuestión también relevante y que mañana va a cobrar más importancia en el taller que hagamos con España, que tiene que ver con, digamos, probar las herramientas que vamos a ir desarrollando en 2 o 3 casos de prioridades que vamos a querer focalizar en ellas. No me detengo mucho en el siguiente elemento, pero esto va acompañado de una rama de intervención que tiene que ver con el trabajo en complejidad de cuidados y todo el tema de identificación de la carga de trabajo de las enfermeras en los distintos servicios y generar, digamos, sistemas digamos, más automatizados, más eficientes y que promuevan una mejor gestión de los servicios, de los recursos humanos en salud en España. El proyecto tiene un desarrollo en el que ahora mismo nos encontramos en esta parte ya, en la que hemos ido trabajando tanto el lanzamiento del proyecto como irlo difundiendo a distintos niveles dentro del Ministerio de las Comunidades Autónomas. Hemos hecho una primera identificación de la que os voy a comentar con más detenimiento ahora mismo y nos encontramos en este punto de empezar a crear consensos respecto a las iniciativas que vamos a utilizar para esos casos prácticos. Ese momento también del workshop que estamos llevando a cabo hoy y mañana, que va a tener formar parte de esa línea de desarrollo de capacidades para las personas técnicas y iremos progresando en este proyecto hasta conseguir todos los objetivos que nos marcábamos y que os comentaba anteriormente. Unas pinceladas simplemente, porque creo que va a ser un tema que vamos a exponer con más detalle mañana, pero sí que me gustaría que las personas de Italia y de otros países que no van a participar mañana en la sesión del equipo español, pues tengan algunas pinceladas de algo que consideramos que ha sido quizás una buena práctica y que ha sido interesante desarrollar, que tiene que ver con la implementación del diagnóstico inicial del proyecto. Hemos desarrollado un cuestionario que tenía que ver con 8 categorías de distintas dimensiones dentro de lo que es la gestión de fondos europeos, con el objetivo de entender bien dónde estaban los cuellos de botella, los desafíos, las potencialidades y cuestiones relevantes dentro de la gestión de los fondos europeos, intentando entrar en cuestiones más micro, más que tienen que ver con la realidad del día a día, de la disposición de recursos, el conocimiento de las diferentes herramientas, buenas prácticas y otra serie de cuestiones. Esto ha sido acompañado por una serie de entrevistas en profundidad a distintos niveles, dentro del Ministerio, dentro de instituciones de investigación, fundaciones adscritas al Ministerio, consejerías de sanidad de las comunidades autónomas, para entender, digamos, esa parte más cualitativa de los resultados que nos daba el estudio y el cuestionario. Esto ha sido, digamos, diseñado con un modelo teórico, con una perspectiva de entender que los fondos europeos se gestionan y se gobiernan a distintos niveles, en distintas fases, y intentar entender pues, los desafíos, buenas prácticas y expectativas en cada una de estas dimensiones. Esto nos ha reforzado algunas ideas y nos ha dado algunas otras ideas nuevas, pero básicamente tiene que ver con eso, ¿no? Que algunas ideas para desarrollar y para remarcar, digamos, la importancia de tener un servicio, una institución, un organismo, un espacio de gobernanza, en cualquiera de los casos, único, que permita establecer algunas prioridades e impulsarlas de forma conjunta y hacerlo junto con la Comisión Europea, y que permita también la difusión de información desde arriba hacia abajo y desde abajo hacia arriba, ¿no? Y que fluya de forma más clara la información y todo el mundo que tenga que tener información pertinente respecto a fondos europeos la tenga. Una de las cuestiones también que ha salido de este cuestionario es la importancia de mejorar la gobernanza de datos, ¿no? Conocer, que todo el mundo que sea pertinente para ello conozca cómo son los flujos financieros en fondos europeos, qué proyectos están desarrollando otras instituciones para poder generar alianzas, sinergias, para poder presentar en sucesivas convocatorias o nuevas oportunidades digamos, de forma conjunta y diferentes cuestiones. Y por último, a través de los casos de estudio que vamos a realizar, pues, digamos, incidir en esa idea de que esos casos de estudio van a servir para realizar unas formaciones y mejorar la formación específica de los profesionales que trabajan con fondos europeos, digamos, conservando y cuidando la carrera de estos profesionales y además dándoles mejores herramientas y mejor formación para que puedan hacer su trabajo.
Some of the challenges that we found in the development of the TSI project is the need of address the concept of fragmentation in European funds governance within a decentralized system with multiple institutions at different levels involved, like in Spain. Also, we discovered the challenge of strengthened data governance, build capacity to identify and manage the European funding opportunities, and also ensure the sustainability of the health investment hub beyond the duration of this project. And for the last part, regarding the expectations that we have and involving the TSI project, we intend to create a functioning and institutionalized health hub, which would be a formal network of local points across all the different autonomous regions that we have in Spain and all the different institutions. Also improve the monitoring and strategic allocation of the European health investments, and to concrete capacity development products. So thank you, everybody.
Thank you very much, Pedro and Daniela, and apologies, Daniela, I didn't introduce you properly before. It was because of a glitch in my agenda here. Thank you, and thank you very much for the really nice summary slide for your expectations in Spain. I think it would be quite useful to bring it back later when we discuss the experience of other countries and see and reflect how that aligns with what they experienced before. So that's part of the point of being here. Before we go to Italy, we have Chris Cotter, who's going to give us a bit of the perspective from WHO side. Thank you, Chris.
Good morning, everybody. My name's Chris Scotter. I work with Thomas Zapata and with colleagues Tom Hughes up in Copenhagen and Mark also. Great to see so many people here. And as always, Chris has a problem with the technology.
Sorry, I'm shooting with this.
Buongiorno tutti. Buenos dias a todos. That is the limit, I'm afraid, of my Spanish or Italian, though I am trying very hard to not be your typical stupid Englishman. Today I'm going to give you a bit of a talk around the Italian EU Resources Hub for sustainable investing in health. It's a magnificent project, brings together some very, very demanding timeframes, interesting people, very clever people, and aims with one thing: to make population health better for the Italian population. So the project objectives is effectively to support the implementation of the reform for in workforce and to support the development of a hub for workforce investment in Italy. The key areas are listed on the right there, but look at fundamentally finalising a comprehensive framework for Italian workforce reform, looking at capacity building, institutionalisation, evaluation and sustainability. The Health Hub, looking at strategic investment, is looking to support the implementation of the National Plan for Governance and Italian participation in European global health initiatives. Again, looking at evaluation, institutionalisation and sustainability. We phased this project. My Spanish colleagues will probably agree with me when I tell you that my colleagues in Italy and I are very impressed at the timetable we're trying to do this in. It's a very, very ambitious timetable, 2 years. And we've spent the first year scoping and developing implementation options and appraising those. We've gone for what we call an early adoption and iteration process rather than a process of pilots, simply because the time doesn't allow us to do pilots and evaluation. So we're going for a process of early adoption, where we will have an implementation through some regional sites. They will review, improve, as the work progresses. And then, starting next year, we'll move into institutionalisation of the projects across the country with those regions that wish to take it forward. The framework we pulled together looks at 4 technical working groups. Technical working groups 1, 2, 3, 4. Technical working group 1 will focus on reorganisation of the regulatory frameworks for health professionals and look at skills certification systems. Technical working group 2 will look at digital transformation and integration of AI within the system. And technical working group 3 will look at the attractiveness of health professions, retention and support for health workers, and looking also at the mechanism for international recruitment. Finally, technical work group 4, and this is where we're focusing on today and tomorrow, we'll look at access and utilisation of funding. We will be bringing together a raft of expertise from within Italy, from the regions, institutions, education institutions, and making access to international experts also. Our kick-off meeting for technical working groups 1, 2 and 3 was last week, this time last week, and today we have the kick-off effectively for technical work group 4. There are a number of cross-cutting needs that we're looking at, and that's a need to look at stronger vertical coordination between the states and the regions, and then the integration across education, labour and the health sectors to simplify the flow, to make to effectively improve the communication and the stakeholder involvement so that the pipeline of activity is synergy across the system. Finally, it's grounded in evidence-based policy making and peer learning. And this is what we're doing. This is what we're doing today. Peer learning. This is an example of where we're going. The priorities are linked with the National Plan for Governance, and the activities really will focus around strengthening government and policy synergy, looking at promoting national actions that are part of European health initiatives, and strengthening Italian contributions to European and the international organisations. And there's a lot to learn from what's happening in Italy, particularly in the area of IT. They are leading the way in many areas, having invested billions of euros over the last few years. The key objectives, therefore, are really quite simple. Deliver better health outcomes across the citizen's life course, from the day they're born to the day that, unfortunately, we all pass. Strengthening the health system to improve and advance universal health coverage across Italy, and fighting health threats, including pandemics and antimicrobial resistance, is key. And that is building capability for the health system to perform at higher levels. The Italian framework will look at increasing the attractiveness of health careers. We aren't in a situation where we get a free ride. Many, many organisations are competing for our intelligent and active workers. We are not in a position where people will gravitate to us as a matter of course. So we need to work harder to make health more attractive. We need to think about how then that impacts on reorganising health professional profiles, and how those health professional profiles need to be reorganised and reconsidered to promote integrated working, multidisciplinary working, transdisciplinary and interdisciplinary working styles as well. And that looks at whether or not the changes are required to certification of competencies and capabilities and how that works. Looking at, importantly, not only increasing the attractiveness of health workers, but also keeping hold of the health workers we've got. We know that health systems in a lot of countries struggle to retain the workforce, and there's a lot of advice out there on how countries might try to do that. But we have to make that much more implementable, and we have to take active progress on it. It's much cheaper to retain a health worker than to recruit a health worker. Finally, and it's unusual for WHO to stand here and say international recruitment when we think about the WHO Code of Practice on international recruitment. But actually that doesn't prevent international recruitment. What it says is that it should be equitable and mutually beneficial to both countries. And so Italy are going to look at international recruitment programs, and to see how they can fit within the code of practice and can actually be supportive to the Italian health system. Finally, they're going to be looking at digitalization and AI tools. And as I said, they've already invested a vast amount of money over the past few years, and it's about coordinating that and bringing it together. So the common themes that enable from that are, and I won't go through all the words here, but are strong multi-level governance alignment, shared resilience and workforce goals, and strong coherence with EU strategies, and coordinated investment and planning, and this is where we're talking over the next few days. The Strategic National Platform will, I'm going to skip this one, we're going to go here. The TSI is nested in the Italian National Plan for Governance and their participation in global health initiatives. And so the aim of the work will also look to position Italy as a proactive European player and a proactive global player. And it will strengthen the governance and coordinate objectives. It will focus on strategic priorities. The key will be to develop governance mechanisms and to look at co-programming actions that align with EU strategies, looking at technical liaison tools and bringing in together dynamic mapping opportunities, communication platforms, and thematic working groups to link actors and opportunities together. Finally, we'll be looking to focus on the operational support provided by Promise. Colleagues are here today to bring that technical coordination together across the country, focusing on the skills and abilities of experts within the country and marshalling that with the experts from abroad. The common threads driving both the agendas then in the national plan and in this this TSI are one, health systems thinking, shared reform priorities and data-driven governance tools, and to bring in broader stakeholder engagement aligned with national and EU investments. I'm going to pause there. I'm going to invite my colleague Mariella Manolfi to come to the stage for her presentation. It just leaves me to say grazie mille and muchas gracias.
Bene, comunque Chris ha detto tutto, quindi posso... Come lo mando avanti? Allora, di nuovo buongiorno a tutti. Dunque, cerco un attimo di sintetizzare alcune cose che Chris già ha detto, soprattutto in relazione ai gruppi di lavoro che abbiamo messo in campo per il TSI. E diciamo che un po' prima nell'introduzione, quando siamo intervenuti, abbiamo accennato un po' all'analisi di contesto, che è il punto di partenza da cui come Paese Italia ci troviamo, diciamo, ad affrontare queste problematiche legate alla carenza di professionisti sanitari. Io, scusate, sento questa voce di rimbombo, non so, voi mi sentite bene? Sì. Diciamo che i fattori che impattano sulla carenza di professionisti sanitari, come dicevo anche prima, sono di carattere demografico, epidemiologico, ma anche cambiamenti delle aspettative della popolazione, quindi dei bisogni di salute della popolazione, nonché un approccio culturale delle nuove generazioni, e questo è un passaggio importante perché è legato proprio alla attrattività del Servizio Sanitario Nazionale e all'attrattività di alcune professioni sanitarie, in particolare gli infermieri, e quindi al tema della iscrizione anche ai corsi di laurea infermieristica. Ed è chiaro che la capacità dei sistemi sanitari di fornire servizi sanitari e soddisfare questi bisogni di assistenza dipende fortemente dalla disponibilità di una forza di lavoro flessibile, quantitativamente adeguata e in possesso di competenze aggiornate. Quindi i fronti su cui noi vogliamo agire sono, diciamo, quelli quantitativi, e lì si ricollega anche al discorso che il collega dell'OMS ha poc'anzi fatto in relazione diciamo, ai professionisti, alla circolazione dei professionisti in Europa e al reclutamento dei professionisti anche da paesi extra-UE. Poi su questo aspetto mi piacerebbe anche confrontarmi con il collega del Ministero della Salute spagnolo, perché noi in Italia oggi gestiamo un po' questo fenomeno in maniera, diciamo, per usare un eufemismo, diversificata, per dirlo nella realtà dei fatti un po' schizofrenica, perché stiamo da un lato rispettando una normativa europea e nazionale che vede il Ministero della Salute come autorità competente nel riconoscimento delle qualifiche professionali, e quindi abbiamo tipo una media di 7.000 domande l'anno di riconoscimento, con una serie di norme puntuali da rispettare per poter riconoscere le qualifiche professionali, e dall'altro abbiamo una norma che il Parlamento ha approvato a partire dal periodo Covid, che consente l'esercizio temporaneo dei professionisti stranieri in deroga al riconoscimento delle qualifiche professionali. Questa norma poi annualmente è stata prorogata in virtù della carenza di personale, quindi questo consente ai professionisti che magari sono in attesa di ricevere il riconoscimento della qualifica professionale di esercitare liberamente sul territorio nazionale senza comunque essere iscritti neanche all'ordine professionale di appartenenza. Quindi abbiamo fatto un grande lavoro con le regioni, con le federazioni, quindi le rappresentanze degli ordini professionali, per disciplinare questa fase che dovrebbe essere transitoria. Però, visto che, diciamo, la questione della carenza, soprattutto infermieristica, è comune agli altri paesi, ci piacerebbe conoscere, insomma, anche come la Spagna sta gestendo questo problema del reclutamento dall'estero e quali politiche sta adottando per cercare di fare anche un reclutamento etico dal punto di vista anche della formazione, quindi formazione linguistica, integrazione della formazione tecnica, ed è secondo me questo un tema ed è un problema presente ma anche di medio-lungo termine, quindi è un tema su cui ci piacerebbe, diciamo, confrontarci. Ora non è chiaramente il tema del quarto gruppo di lavoro, ma ho colto l'occasione, vista la possibilità, diciamo, di questo confronto anche con voi. Poi noi in Italia abbiamo 31 professioni sanitarie, abbiamo 51 specializzazioni mediche, abbiamo un'età, diciamo, dei professionisti sanitari che è abbastanza alta, soprattutto, diciamo, adesso per i medici si sta assorbendo la curva pensionistica, per gli infermieri invece abbiamo un problema, avremo un problema anche nei prossimi anni legato appunto all'invecchiamento proprio di questa categoria professionale. Quindi ci troviamo in un contesto demografico in cui abbiamo invecchiamento della popolazione, invecchiamento dei professionisti, calo delle nascite e ovviamente, come dicevo, ridotta attrattività dell'impiego presso il Servizio Sanitario Nazionale e crisi vocazionale per alcune professioni sanitarie. Quindi condizioni di lavoro che necessitano di miglioramento, perché dopo il Covid, durante e dopo il Covid si è rafforzato, si è amplificato questo rischio di burnout, e un'esigenza giustamente sentita dalle giovani generazioni, che è quella di conciliare i tempi di vita e di lavoro. Abbiamo quindi questi sono i dati Istat che ci mostrano proprio l'invecchiamento della popolazione, dove la percentuale, come potete vedere, è molto alta, perché si stima che le persone di età pari o superiori a 65 anni nel 2050 potrebbero rappresentare il 35% del totale della popolazione. E in questa slide invece vediamo proprio la crisi vocazionale, soprattutto appunto degli infermieri, quindi anche se abbiamo aumentato i posti nei corsi di laurea, abbiamo comunque un problema di attrattività all'iscrizione al corso di laurea in infermieristica, dove il rapporto fra le domande e il numero di posti attivati a livello nazionale è di 0,9, cioè vuol dire meno di un candidato per un posto disponibile. Salto la parte della remunerazione, non stiamo messi bene soprattutto per gli infermieri, diciamo. Quindi soprattutto non so, la Spagna forse sicuramente un po' meglio di noi, sì, quindi salto questa slide e diciamo che appunto tutto questo contesto di crisi va chiaramente affrontato, e noi lo stiamo affrontando con 3 livelli di piani d'azione. Quindi uno è proprio quello della programmazione e degli investimenti sulle competenze, l'altro è quello sulla valorizzazione del capitale umano e poi l'innovazione, soprattutto quella digitale, per ridurre la pressione sul personale sanitario. Abbiamo, come accennavo prima, un disegno di legge delega di riordino delle professioni sanitarie e con il TSI, quindi diciamo che l'obiettivo è, nell'ambito del rafforzamento della cooperazione fra le istituzioni nazionali, europee e regionali, fino appunto ad arrivare chiaramente alle aziende sanitarie, vorremmo cercare di migliorare la capacità del Servizio Sanitario Nazionale di attrarre e trattenerlo, perché un altro fenomeno che abbiamo è quello delle dimissioni, cioè molti medici, professionisti si dimettono dal Servizio Sanitario Nazionale per lavorare nel privato. E l'altro, che poi è il punto del gruppo di lavoro di questi giorni, è proprio il coordinamento degli investimenti attraverso la creazione di un polo per integrare e orientare al meglio i fondi europei e nazionali, quindi cercando anche da lì di trarre delle azioni concrete. Quindi praticamente con la riorganizzazione dei profili sanitari che abbiamo in atto vorremmo rivedere un po' e attualizzare le competenze in un'ottica soprattutto di flessibilità. Non so cosa accade in Spagna, ma noi abbiamo una legge sulle professioni sanitarie dove diciamo, gli ordini professionali spesso vanno in conflitto fra di loro, perché ognuno tiene a mantenere il suo profilo di competenze e quindi per legge è vietato che le professioni sanitarie, soprattutto quando ne nasce una nuova, abbiano delle sovrapposizioni di competenze, però a me piacerebbe lavorare con il superamento di questa concezione di sovrapposizione di competenze, trasformando il concetto di sovrapposizione in invece collaborazione, cioè area comune di competenze, cioè non è detto che non possano essere più professioni sanitarie a svolgere alcune attività, soprattutto in un'epoca di carenza di alcune come quelle infermieristiche. Quindi la trasformazione digitale per ridurre il carico amministrativo e liberare tempo clinico. Quindi cercare anche strumenti di incentivazione e modalità flessibili di inserimento lavorativo, studiare nuovi modelli organizzativi che favoriscano, come dicevo, il benessere organizzativo, la conciliazione vita-lavoro, servizi di supporto e di welfare al personale sanitario, la certificazione delle competenze di cui prima parlava Chris, cioè appunto un sistema che così penso altri paesi europei hanno, noi ancora non l'abbiamo perché noi abbiamo un sistema di formazione continua, abbiamo il valore legale del titolo di studio, quindi il riconoscimento dei percorsi specialistici universitari, ma non abbiamo un sistema che poi certifichi competenze acquisite anche sul campo o comunque nel percorso di svolgimento della professione. E poi sul reclutamento dei professionisti all'estero vorremmo appunto anche provare a semplificare le procedure, chiaramente nel rispetto anche della cornice europea. Quindi questi sono i punti cardine: attrattività e retention verso il Servizio Sanitario Nazionale, riordino delle competenze dei professionisti, trasformazione digitale, certificazione delle competenze, attrattività e reclutamento internazionale. E quindi vorremmo appunto migliorare la flessibilità, valorizzare le competenze, introdurre anche figure di supporto come è accaduto per gli infermieri, dove è stata creata la figura dell'assistente infermiere. Abbiamo tutto il tema della trasformazione digitale, come dicevo prima, anche a supporto della qualità e dell'accessibilità dei servizi e ecco, vorremmo appunto creare dei meccanismi, grazie anche a questo lavoro che sta per iniziare sui fondi, cercare anche la possibilità di incentivi economici per i professionisti sanitari. E questi sono appunto i gruppi di lavoro di cui ha già parlato prima il collega dell'OMS e quello di oggi è appunto l'Hub per gli investimenti in salute. È un progetto ambizioso, fortemente ambizioso e vorremmo cercare di sviluppare un piano di governance per l'utilizzo e la gestione dei fondi nel settore sanitario, con l'obiettivo proprio di ottimizzare gli investimenti, migliorare la gestione dei fondi, supportare l'adozione di buone pratiche in ambito sanitario. Quindi per questo diciamo, è importante anche ascoltare in questi giorni quali sono le iniziative di successo già svolte e realizzate dagli altri paesi europei, redigere una roadmap per la complementarietà dei fondi anche a supporto della forza lavoro sanitaria, quindi garantendo che i finanziamenti siano utilizzabili in modo efficiente e quindi magari anche cercando appunto di definire una governance a livello nazionale, definendo appunto obiettivi, azioni necessarie per raggiungere un determinato risultato, quindi cercare anche nel contesto del gruppo di lavoro capire quali sono, come possono essere utilizzati proprio per sostenere quelle che sono le priorità sanitarie di cui insomma abbiamo parlato e parleremo e stiamo affrontando anche negli altri gruppi. Grazie e buon lavoro a tutti.
Thank you very much, Mariella. This was really fascinating and also very clearly setting out the background of why Italy is looking at what you're looking at and the specific steps that you're taking to work with this health hub idea to improve the situation. Now, before we start into the next session, I know we're running a little bit late, but I'm going to take a couple of minutes to give everybody in the audience a task. So this is a wake-up call. I know you are all colleagues from Italy. Listen very carefully to Pedro and Danielle before, and colleagues from Spain, listen very carefully to Mariella and Chris. And the question for you is, for your country, which part of what the other country is doing is particularly interesting for you? Like, what did you see for the Italian colleagues? What did you see in the Spanish project where you thought we should definitely find out what comes out of this initiative? And for the Spanish colleagues, the same. Which part of what the Italian project is doing is particularly interesting for you? You can raise your hand. We have a moving microphone. We take maybe a couple of ideas. Nobody is taking notes, so you can just share what sounded particularly catchy and interesting for you. In any language you like, Italian, Spanish, well, not in any language you like, I'm sorry. Italian, Spanish, and English. If you want to do it in Greek, I will understand and I will translate. Anyone? Yes, please.
Okay, thank you. Well, actually from an Italian point of view, okay, well, I would like to go more in depth or what Eloy just presented briefly about the strategy and the governance that are establishing here in Spain, first of all. And the second aspect is the one that Pedro mentioned about the improving of one of the results that you expect from your side, improving the management and the governance on nurses. These are the 2 points.
Okay, 2 very good points. Thank you very much, Paolo. Anybody else? Yes. I think we have a point from Eloy, and I think there is a moving microphone that's closer. Yes, that's perfect.
Me ha parecido muy interesante la exposición italiana. Creo que tenemos problemas comunes. A mí en concreto me gustaría conocer más en profundidad cuál es el desarrollo profesional de la figura que han creado de enfermero asistente, que me ha llamado la atención, me ha parecido interesante. Y también me gustaría conocer cómo ellos están organizando el despliegue territorial. Nosotros en España tenemos problemas similares, lo llamamos la España vaciada o la España interior, donde tenemos a veces pues, ratios de población y envejecimiento muy avanzados y poca población, y desplegar los servicios sanitarios en esas regiones es difícil. Yo creo que ellos tienen también mucha experiencia en cómo desplegar en el territorio los servicios de salud y nos interesa especialmente conocer cuál es su perspectiva. Muchas gracias.
Thank you very much, Eloy. Anybody else who is maybe here for the first time? Do you hear something really interesting? I mean, it's unfair to ask it so early in the discussion. But what's interesting for me from the points that we just heard is that there seems to be a combination of the things that are specifically addressed in the projects and larger initiatives or larger challenges within the 2 health systems that maybe have common solutions or interesting ideas to borrow from each other. And I think that makes it particularly salient for me why meetings like this make sense. So they are an opportunity to exchange not only on the project, but also on any other shared insights that you might have. Giving everybody last 20 seconds to give us maybe, yes, thank you.
I'm Giovanni Capelli from Italy. I found 3 things that attracted my attention, and they were the mention of the Statuto Marco. It should be interesting to know how and what is in there to know if it can be an inspiration also for us. Another issue, it would be interesting to know more about this idea of the one-stop shop model, because it may mean a lot of things and should be interesting to know more about that. And Pedro told about developing a system for patient classification, if I understood well, to estimate the effort of the health personnel. So differently from the system you use now to estimate the money spent or the reimbursement and something like that, this idea of approaching the burden of the patient on the personnel seems something different, and this should be another interesting issue for us to know.
Okay, thank you very much, and very well noted. I think we will have opportunity during the day, tomorrow morning, in the joint session that we have to exchange on some of these topics, but I would also encourage you to just seek each other out in the breaks and over lunch to maybe discuss more informally about some of those things that might be harder to tackle on the stage here or in the room. All right, I think we close it for now, but we're going to do rounds of these types of questions throughout today and tomorrow. So be prepared, and we really want to hear from everybody. Right, and I think now, Pedro, I pass you to introduce the next session.
Yeah, thank you very much, Dimitra. We'll have now the session 2, EU funding tools for health system, state of play and future outlook, that will be facilitated by Julian Wilgenholm from the Observatory.
Thank you, Pedro. Thank you. Good morning, everybody. My name is Juliane Winkeman. I work at the Observatory on Health Systems and Policies. In this session, we will dive deeper into questions of EU funding tools, which we then have country presentations from the previous TSI projects. But first of all, I have the pleasure to present my colleagues Nicole Maurer and Dimitra Pantelli, which you have seen before, to give a presentation on the complex landscape of EU funding tools and also how the previous TSI project used it. Please go ahead, come on the stage.
Yes, wonderful. Indeed, so thank you everybody for giving us your time. A couple of you have mentioned this one-stop shop idea for EU health funding access and wondered where it comes from. We will provide you some of the background. I already mentioned this morning, we'll skip over that, that at the Observatory we are a partnership. We're trying to bridge knowledge with decision making, and part of that discussion is really making sure that we provide information, the right information in the right way at the right time to those who need it. This is our knowledge brokering model. You can see it on the slide. As part of that, we supported the Slovenian presidency of the Council of the EU a couple of years ago because they realized that there is so much offer from the EU that health systems can make use of, but it's in different instruments, it's quite fragmented, the rules aren't always clear, and specifically when you have, especially when you have a small country with perhaps limited capacity at the ministry, it's impossible to really master everything and to understand which tools can you apply for, what maybe if you get some type of EU support, what disqualifies you from other types of support, how you can combine support, financial support that you get from the EU with funds that you put in from your own health system. So for all of these complex questions, we were asked to provide the evidence and the answers as Slovenia was preparing for its presidency. So what we did, led by Nicole to my left, was produce a policy brief. This is one of our standard formats, as you see on the right. This is publicly available, and try to map all the different types of tools that the EU provides for its member states to use and strengthen their health systems. We always say here, we know this, you know this, that the EU has limited competence when it comes to the delivery of health services in different member states, but it does provide different types of support for member states to advance and strengthen how they organize their health systems. So what we did for this policy briefs in the beginning was think about what types of support health systems could possibly need, and think about it through the process of change idea. So where we, in the process of thinking about policies to address challenges, where can the EU help, we first categorize the type of support that could be needed. So if you think about it, and we heard about several of those stages today, you know this very well from your daily practice in the policy cycle. You start with an idea about what you can do to address a problem, to address a challenge, to improve the situation. This idea needs to turn into a plan of the types of measures you can implement, which you then need to test in the real world to get an understanding of whether they work before you can actually implement them on a large scale and evaluate them to see if they work as you want. This is a classic model in the policy cycle, in the public health cycle, and this is also what we used for classifying the tools of that the EU provides for member states. Now, it's not just about at what point in your thinking at the policy level in health systems you might need support. It's also about the type of support that you can profit from. And there we categorized in 4 you don't see that very well on the slides, in 4 different levels. So types of support that include policy, so support in thinking about what to do, funding, so very clear financial support, primarily for infrastructure and other types of development of resources, information to help think through more specifically what types of measures you can implement and what is good practice, but also implementation support in the form of technical assistance. We have fancy moving slides, but I won't go into a lot of details for each of those because you don't need to know this very, in such detail. The idea is to provide this overview of the fact that the tools that the EU provides span all of these categories in the matrix that you just saw before. So if we're thinking about policy direction, the Commission provides different types of recommendations, for example, through the European semester, but also advice on coordinated action through its different instruments, like, for example, Commission communications. And although these are ideas or prompts that aren't binding or mandatory, they do have weight, of course, for member states, and they do provide the context for action. If we think about funding, and this is something that, knowing who is in the audience, you will all have some type of experience with, we can think about different funding instruments, like the cohesion funds, like the Recovery and Resilience Facility, which we're all familiar with in the context of the COVID-19 pandemic, but also perhaps of less obvious instruments that health systems can use that maybe we don't think about, like the European Investment Bank. Finally, when we think, not finally yet, sorry, one more category after this, when we think about information about how we can develop the right interventions, how we can develop the right measures, there are a lot of different funding opportunities there as well, and support opportunities through the health program, the EU for Health, but also through the research programs like Horizon Europe, and the technical agencies of the EU, such as the ECDC and the EMA, where you can get, as a member state, technical advice and scientific evidence to support your thinking in how the reform, any reform that you plan can look like. And then when we think about how we scale up and how we put our good ideas into practice, that's the final stage, the stage of implementation or technical assistance for scaling up at the national context. And there, of course, we have the technical support instrument, which is the instrument that supports this project for which we are here today, but also other services that are advisory in nature and help to support member states in large-scale implementation, like the InvestEU Advisory Hub. Now, what we did also, and what we realized when we were looking at the different types of tools, was that there is a lot of instruments that are not directly labeled as health-related, that are, however, possible to use for health systems, which is a very important piece of knowledge and makes the life of those who are responsible for thinking about what EU support could possibly be available a little bit harder. And if you look at the size of respective tools, you can see it not very well on the screen, the yellow bubbles. There is a little green dot, which is within the big blue circle, and that little green dot is the health program, so the program that is specifically dedicated for health actions. But the bigger, much bigger yellow bubbles in the figure are other instruments. So the biggest bubble on the right is the Recovery and Resilience Facility, but the little bubble top left, for example, are the cohesion policy funds. And you can just see let's say, the contrast between the size of those instruments, and just as an impetus to realize there is a lot of support there if you don't necessarily looking for, if you're not necessarily looking for the health label. Now, we know, and Nicole will talk about this in a minute, that the way these tools are structured and shaped is going to change. So it's not going to look exactly like this for the next many years. But this is just an idea to say, when we think about how the EU can support health systems, we need to think outside the box of how we define an instrument that supports health initiatives. And I think with that, Nicole, I pass to you.
Thank you, Demi. So, yes, we've already heard about the last TSI project. I'll just mention it very briefly because this was following our work for the Slovenian presidency and their council conclusions, which were calling for a one-stop shop to improve the use of EU funding instruments. And this is how this project was born. So it's a multi-country project between Austria, Slovenia, and Belgium. And the overall aim of the project was to improve member states' capacity for sustainable investment in health systems. It was delivered across 2 work streams. The first one was more on making the economic argument for investment in health systems, and then work stream 2, which is more relevant for today, is about the one-stop shop and establishing this EU health resource hub. The 3 countries chose specific policy priorities in line with their ongoing reform efforts to focus on, and we'll hear more about this from the country representatives, so I don't want to take away anything, just to say it was very diverse. So Austria was focusing on the environmental sustainability of health systems, Belgium was focusing on integrated care, and Slovenia on primary healthcare. So 3 really big but different topics. And within this work stream 2 of the project, we designed an updated mapping. Again, you can't see it very well, but it's more colorful than the other one. And this shows again that there's a range of different instruments, that they're not clearly labeled as health, but they are relevant for health systems. And they are relevant across these different types of policy issues that the countries were dealing with. So this is the mapping that we produced, and it is likely to change, but it still is relevant to see what the broad range of instruments is, and that they have very different budgetary sizes and different characteristics. We also developed a catalogue of instruments, so we were thinking about how to make this document that we were producing useful. So we have these fact sheets on every instrument, bringing together just the most practical, relevant, nitty-gritty information on the different instruments. So it's application, like how do you apply, what are the eligibility criteria, how big is the budget, and we also have comparative tables that analyze the different rules of these instruments, how are they managed, what is the information you need that really has implications on how you can use these instruments. And just to give an example, if we think about management, the way that these instruments are dealt with and implemented has an impact on how you can use them. So if they're directly managed by the Commission, calls for proposals, everything, the whole project cycle is managed centrally by the Commission and its executive agencies. So the calls are EU-wide, so arguably more competitive. You're competing against entities in all European countries, and generally the priority setting reflects EU-wide priorities. Applications all work through a single portal, and on the other side you have shared management instruments where the shaping is a little bit different because the implementation happens at the national, regional level. You have managing authorities which launch the calls, select the projects, and there's this sort of bottom-up and top-down shaping of the priorities where you also have reflected local, regional, national priorities, ideally. And the oversight happens through the Commission. So just to say that these details were put together in this publication, and they're really important for using these instruments in real life. We also produced a policy brief where we zoomed into the Austrian case study, and we've really looked at their experience applying for EU instruments, and we'll hear from our colleague in Austria in the next session who will talk about their experience with this. So I'm not going to go too much into it, but producing these various publications, working with these different countries, we've taken away, we can draw some key takeaways, some lessons. And that is, as I said, that we have many instruments, but there is a challenge of aligning the objectives of different tools with the needs of national health systems and the interests of different health systems, which can be similar but can also be different. You also have to think about the window of opportunity in terms of timing. Sometimes you really have to align with the time frames of different programs, the application criteria, the eligibility criteria, and that's not always easy to translate into actual project applications. It's very time and resource intensive, as we will hear from our Austrian colleague, and it often requires very specialized knowledge and very long documentation. So that's not a skill that is easy to have and everyone has. And therefore, there is scope for making this process of identifying and using these instruments a little bit easier to navigate for policymakers. So, looking ahead to the future, how will the funding landscape change? We've said there are many instruments, they can support many different policy issues, they can support different stages in the process of change, but what will happen? The answer is we don't know yet. There are some indications. We have a proposal by the Commission on the new MFF, and we know that the proposed budget is slightly higher than the current one we have. There are proposals for simplification, for streamlining, and for reducing the number of programs from 52 to 16, so that means merging different programs. In terms of health impacts, we know that the EU for Health, according to these proposals, will be incorporated in this new European Competitiveness Fund, which deals with a broad range of issues from defense to space to research and innovation and also health. Also relevant is that the RRF is clearly coming to an end, so that instrument will cease to exist, and the cohesion policies and the agricultural policy will be channeled through these national and regional partnership plans, which will take on a sort of performance-based nature similar to what the national recovery and resilience plans have had. And so, yeah, this is clearly an important time where the shaping of these instruments as they go into Parliament and are currently under discussion is the time in which they will be shaped, and that means we don't know what they're going to look like, but there's still much room for shaping. We also have an indication of the sorts of themes that will be relevant, particularly in the area of public health. So we know that the portfolios that are currently ongoing, including the health data space and the revision of the pharmaceutical legislation, will continue to be implemented and will be important, but we see this movement towards innovation, industrial capacity, competitiveness, but also non-communicable diseases, the Safe Hearts Plan, so CVD, as well as preparedness for health crises, which are likely to play an important role. And lastly, just to say that the European Competitiveness Fund will have several policy windows, according to the proposal, one of which is dedicated to health, biotech, agriculture, and bioeconomy. And if I'm not mistaken, the overall fund has 230 billion euros earmarked, of which around 20 billion will be for this policy window. So yeah, as I said, we don't know yet what we're going to get in the end, but we can draw some early considerations that in terms of what that means for health systems. So the impact that it will have on health systems really depends on which funding instruments will be most affected, because as we've seen, they tend to fund different types of initiatives along the process of change. So clearly, EU for Health, which is more about generating evidence, is different to the ERDF, which we would use for capital investment and infrastructure. They differ enormously in budgetary size, so that also has important implications depending on which fund will be more affected or incorporated into other funding instruments. And even though the funding instruments may substantially change, it could also be that the expertise and the capacity that we need to apply for them, to identify them, to use them effectively will not change. And yes, we have proposals for the simplification and streamlining, but we'll have to see what that looks like in practice. And I think I will stop here, and then we'll hear from our colleague at the European Commission who can complement and contradict everything that I've said. But I don't know.
Just before Simona's coming on stage, are there any questions in terms of the publication that my colleagues presented? We will feature them during the break on the slides, so you have the QR code to download them. But are there any questions to Nicole and Dimi? Or we take later?
Maybe during the coffee break.
Yes. So I have the pleasure to call Simona Boselli from the SG Reform to, yes.
Thank you. Yes, I do. So Hello again. Buenos dias. Buongiorno, everyone. Nicole, don't worry, I'm not going to correct anything. What I'm going to do is to complement slightly and perhaps very shortly, as we all need to have a coffee break, myself included, just to make a consideration on where we're going for the next multi-annual financial framework for the period 2034, and what the role of health is in this context. It's in our proposal, so here there is an important distinction to be made. This is, I'm talking about the proposal that was made by us, by extension, the European Commission in July last year, which proposed a larger multi-annual financial framework with almost 2 trillion of euros, which represent a little bit above 1% of the entire European Union gross national income, in order to match our needs and ambition. On the basis of the experience that we have had with the Next Generation EU and the Recovery and Resilience Facility, we're looking more to a result-oriented, simpler and more agile framework, and having a clear focus on key priorities. Here you can see the progression of the size of the MFF in the past 20 years almost, with the difference that because of the COVID-19 pandemic, the Next Generation EU budget was financed with loans as well, so we need to start repaying those loans. But perhaps this is important to note that this represents a relatively low, and this is something that is not very commonly known, a very low percentage of the entire continent gross national income. The budget, as Nicole has already pointed out, will be simplified in terms of the number of programs. It aims to be simpler for beneficiaries in this sense and focus on results, but also leave flexibility to move on in different ways. I have many more slides in here, but I would like just to focus on this one, which is the same one that Nicole has used, so I think we have had the same approach, to just highlight that there is a transition to a different approach to health. That's necessarily the case. There is not a ring-fenced EU for Health program, but the work that we have done together has shown that health is in that many different policies, perhaps not in all policy, but still in many different policies. And for example, just to say a few numbers, we have a briefing that our colleagues in the DG ECFIN just published on Tuesday that highlights a little bit and provides recommendation on fiscal sustainability of health and long-term care system. It also indicates and collects the numbers around the spending that we've done in health. If you combine RRP, so Recovery and Resilience Plan, and, for example, Cohesion Fund, you already had 56 billion euros spent in the period that will be spent in the period 2021-2027. On top of that, you'll add the money from the EU for Health budget, which was an unprecedented budget as compared to public health in the EU. Just for comparison, probably 1 year of worth of work plan for EU for Health was worth as much as the previous 500 million public health program. And on top of that, we also have Horizon Europe. So that represents a clear shift, an alignment with the priorities. So you see that in the European Competitiveness Funds, and there's already, and that I do not disagree with you, that numbers are correct, Nicole, as per our proposal. That will be a window that, a policy window that focuses on health as well, which will still be substantial. but some of the focus will be aligned with the overarching focus on competitiveness in Europe. But clearly, having a Europe that is healthy and that can support its citizens in being healthy is a pillar for the competitiveness of the continent. And you can see that also in Horizon Europe will be maintained. The health component of Horizon Europe will also be once again there, and it's critical element once again for competitiveness. And particularly driven by the experience that we have had on the Recovery and Resilience Plan, now we have the introduction of the National and Regional Partnership Plan. Now here there is also some work to be done by Member State authority in collaboration with European authorities in designing those national and regional plans. And here, clearly, the focus can be also, and very much so, on the social element of these plans. In line with the discussion and the recommendation done within the economic semester that will drive the development of these plans. And here, the health dimension is clearly important for every country. And therefore, whilst there is no individual place for EU for Health, as there is no individual place for a technical support instrument, if I may say so, what we have learned is that it will transform in a different way, and even, for example, to take in consideration the technical assistance or technical support in the national and regional partnership plan, this may become even more important as there will be support for individual member states in their investments and accompanying reforms. So here still has to be seen, because obviously, as Nicole already introduced, the process now is the classic deliberation at European level, whereby the European Parliament will respond to this budget, and in co-legislation with the member states will define what it will look like as of 2028. So we still have a couple of years of work ahead of us. This said, there is space in health for health in the next MFF. Thank you very much.
Thank you very much, Simone. I open the floor for any questions to Simone. This is the chance, or later today, obviously. Is there a microphone? Yes, please, you can also come to...
I'm already here, it's okay. It's just on this point Nicole made before, Simone, about the skills that colleagues have been developing and that we are developing here for accessing the current funds, and to the extent to which these are still relevant if we're going to be changing the way the funds are set up completely. In my sense, a lot of the skill set is the same, like understanding how the EU works and how funding works and how blending works, but maybe you want to reflect on that a bit.
That is an excellent question. That's why we have a technical support instrument to respond to this question. No, but I think that many of the programs, as you can see, will still remain similar. So, you know, it also based on rule of law and a number of other indicators for success. But if I have a recommendation, is to look at how the Recovery and Resilience National Plan were done. So based on results and outcomes, and clearly identifying what the accompanying step, for example, on the reform process should be. But clearly there will be more driven by the collaboration with national authorities, and here the role of the authorities is increasingly important to define that. Other than that, I think knowing the process is still critically important, and I invite you through the authorities to follow what is happening. Thinking to come up with, in this phase, also with proposition and solution. That's always an important opportunity to have now. And then the good project management skill, the focus on results, the outcome and the reporting, those will still be there.
Thank you for this insight. I think this links also to the session later this afternoon, session 5, where we talk about EU funding instruments, Italy's and Spain's experience, so there will be more space for discussion. I would like then to open, we go for the coffee break and resume, we are on time, at 11:45. And the coffee break is on the right, just go out there.
Thank you.
Thank you.
everyone.
Can we ask you to take a seat again? All right, let's get started. I hope that the coffee break re-energized you and you're now ready to dive into this next session, which is all about country experiences in the past TSI project. We've heard about it already. The word one-stop shop was mentioned, TSI was mentioned, just to put the puzzle pieces together. So during the Slovenian presidency, we were asked to produce this mapping of EU instruments, and based on the findings from this exercise, the Slovenian presidency, in their council conclusions, called for the creation of a one-stop shop. So this place at EU level that would allow member states to get support in better accessing EU funds and making better use of them. Following up on that, we had the first TSI project, and this project brought together 3 countries who started piloting their own case studies and led now to the moment today in the second generation of projects. So we have with us, very happy to have with us, our country representatives from Austria. We have Klaus Kleiner from the Ministry of Health. We have Dusan Jozef from the Ministry of Health in Slovenia. And online with us, we also have Anne Svalue from the Belgian Ministry of Health. And I'll pass the floor now to Simone just to say a few words about the TSI, and then we'll hear from our country experts. Thank you.
Thank you, Nicole. Yeah, it feels like it's the awards season and the Oscar are coming soon, but we are not, unfortunately, presenting any awards to anyone. This said, we have supported the country following the work of the Slovenian presidency in trying to help country better make sense and use strategically of the existing European funds for health. This was a clear need that was recognized by the free country. We have created the first EU Health Hub, which included the colleagues from Austria, Slovenia and Belgium, which will present on their individual achievements, if we were to say, and their lesson learned and still challenges ahead. Technically, the TSI, which we are doing now between Italy and Spain, is broader. As a matter of fact, we are working under the umbrella of a EU Health Hub Part 2 with Italy, Spain, but also with Germany and Sweden, where we're looking at specifically the role of hospitals or transforming the role of hospital, particularly with a focus on prevention activities, as well as with Malta in long-term care. And still slightly different, but still in the same way. We're also working with the Netherlands to understand better what are the new dynamics and the new economics of prevention as well. So still watch this space. In the next 18 months, 24 months, we will have more results to follow. But without further ado, I would want to introduce Klaus. Please come here and introduce yourself.
Thank you. My name is Klaus Kleiner. I'm here on behalf of the Austrian team who participated in the previous TSI project, and I'm really happy to share our experiences today with you and to see how the whole project evolves and develops in the subsequent project. So I will start. I will start by briefly explain why we participated in the TSI project at first, and then go deeper on our experiences and our learnings. So, as we heard a lot of times today, the healthcare systems are facing challenges with regards to the aging of the population, for example, and the higher prevalence of NCDs, and so on and so forth. So, the main challenge is how can we ensure high quality healthcare for all in an efficient and fiscally sustainable manner. And this question and this challenge makes it obvious that there is a need for reforms and structural reforms. And in this regard, it's also very important, and we saw it as very important, to make the case for public investments in health, because this is exactly what we need to get funding for the reforms that we need to make and to create a sustainable and more efficient healthcare system. And another part, of course, is that there are already a lot of funding opportunities, as we heard before, and was also very good portrayed in the report by the observatory. There are many funding opportunities that already exist at an EU level, which are oftentimes not solely focusing on health, but they're out there, and so we have to optimize and be better in accessing those. And another aspect is that the funding landscape is very complex, and therefore we joined the TSI project, which focused on 2 work streams, as we heard before as well, so I will be brief about this. The first work stream focused more on the general capacity of making the argument for more investments in healthcare. And the second work stream, which I will focus on now, is what was more about how can we better and improve the access of the existing funding opportunities at the EU level. And for the Austrian case, we initiated a pilot project on the greening of healthcare facilities. So why did we choose that topic? Of course, climate change is a major challenge which we are facing right now, with implications that go far beyond the environment itself, but also affects our society and the health of our population. But it's not only that we are affected in our health from the climate change, but also in Austria and everywhere, healthcare is also accounting for a significant amount of the national CO2 footprint. So we thought it's important to do something about this. And although we already had some measures in place, we thought further actions were needed. So the main goal of our resource hub was to make healthcare facilities greener and more energy efficient by linking the projects to existing EU funds. And to start our project, we invited healthcare organizations in Austria to submit brief summaries of project ideas that are innovative, green, and already at the developed stage, so that we can help them in receiving funds and link them to the existing opportunities. And together with experts and based already and through the lens of what are the opportunities out there, we chose the 3 most promising projects that got supported in working out the application form and through the whole process of submission. And we chose, out of the many different instruments that there are out there, we chose the LIFE program, which is a program at EU level which is competitive, so you're competing with other projects across Europe for all of the projects. And out of the 3, 2 actually submitted a proposal. So in 2023, in the first round, so to say, we had one project of a healthcare provider, which is called Tirol Kliniken, and where they wanted to transform their University of Applied Science for healthcare services with a more ESG approach and include sustainable mindset in the curricula, use become more resource efficient. And in the first round, they applied and they did not receive funding because you get points, and they did not receive enough points, so to say, but they received a lot of feedback, and very detailed feedback and very good feedback. And in the discussions with the project partners, they told us that this was something that got them motivated, because now they knew what they had to focus on in the next round of application. So they decided and were really motivated to join again or try again in the year after, so in 2024, in the next call for this program. And also the other project, which was also a construction of a new ward in a hospital in Styria, which was initiated by our project partner, also the hospital, Kages it's called, it's like the hospital facility. And they also made use of the feedback that in the previous year the other project got and incorporated the feedback and the ideas. And in the second year, so 2024, the project Health Education Goes Green was a very good call again, and they improved in the points they received, but still fell short, I think, by around half a point, so it was a bit unfortunate, but still we saw a big improvement in the application. So now we'll speak a little bit about the learnings and what we learned from this project. So what we saw is that it's really, really important to have an overview on the funding opportunities that there are out there and the requirements as well, of course. So that there is somebody that can help you and tell you where to look at, what do you need in specific criteria, and also the more informal things when you read an application. Where do I put my focus on when there is just limited space on text that I can submit? Where do I put my focus on? What should I say? And so this is something that is really important, at least in our perspective. And with that comes also the exchange, which was considered very crucial for our project partners, because, of course, as we saw in the project in Styria, they learned also from the feedback that the others got. So the exchange of healthcare facilities that want to apply for certain EU funds would also benefit a lot from the exchange and the network. And even at a prior stage, so to say, when you want to ask other facilities how they do specific things in applying and what they consider a relevant and suitable project. So networking and exchange is something that in our case was really important. Something that Nicole mentioned before, what we also realized is that applying for EU funds is very time and resource consuming. So in our case, it's really important that the application itself, or the application form itself, demands a very detailed knowledge on the project. So this is not something you can somewhat outsource or do in that kind of sense, but this has to be done by the experts within the house, within the healthcare facility that are responsible for the project. So you need a lot of in-house, so to say, time. In our case, they estimated that it's around 1 full-time equivalent for the duration of 2 months that they spent just on submitting the application form, so to say. But what we also saw is that although not every project then in the end got really submitted, but the criteria which are always looking on long-term and supporting the strategic and holistic thinking are some aspects that got incorporated by our project partners, even though they might not even apply in the end. So this criteria and reading through applications is something that, although not actually showing up in the end through an application, is something that's really incorporated then in the institutions that deal with that matter. And of course, something else that's also important and was important in our case is that it's not that you don't only focus on the EU funding, but you also check and look for any other additional funding on the national level. So you might link certain projects on a national level and then on an EU level, or do that simultaneously and not just one by another, or just focusing on one or the other. Thanks for your attention, and I'm happy to...
Thanks so much, Klaus. Are there any questions for Klaus right after this first intervention? Yes, I see. Can we get a mic? The back. Otherwise, I think there's one here. No? Thank you. Yeah, at the back. Yeah.
Hola, buenos días. Ha comentado que buscaron como asesoramiento para que les orientaran cómo encontrar las líneas de ayuda, y me gustaría saber cómo lo hicieron o a través de quién se puede encontrar ese apoyo.
Sorry, can you repeat the question? Sorry.
You didn't have interpretation.
No, que comentaba que has comentado que buscasteis asesoramiento para que os indicaran posibles líneas de financiación o posibles fondos, y quería saber cómo lo hicisteis o a través de quién.
If I understood the question correctly, it's about the consulting aspects of our partners, right? And how we receive the consulting part. I think so. Yeah, in our case, we were partnering up with a consulting company that already had a good view on the Austrian landscape. So this is, of course, something that was helpful in that regard. We also had, we could start, because the Public Health Institute in Austria, which we are working very closely to, they had already a department that looked more on a national and more broader level on greening initiatives in the healthcare sector. So that was already also something that we could connect somehow and could broaden the picture on an EU level, because this was rather national, but also rather small, so to say. So this was also something that we, their expertise was also very helpful. And then, of course, our help by the Solve partners was also very important, because they actually stayed in touch with the project partners, helped them and consulted them on how to interpret certain aspects, and yeah.
So you had an external consulting company that helped with the application process as well, and yeah. Any more questions? Yes, I think there's one over there. If you could raise your hand, so yeah.
Più che una domanda, Regione Puglia, Italia. E più che una domanda è una testimonianza. Anche noi abbiamo lavorato sia con la passata programmazione che la nuova programmazione nel nostro piano regionale, nel nostro programma regionale FESR, per finanziare interventi di transizione ecologica per gli ospedali. Ed è stata un'esperienza molto positiva. 80 milioni nella passata programmazione, 120 milioni nell'attuale, in un lavoro insieme ai colleghi della transizione ecologica, che hanno ritenuto, proprio perché le strutture ospedaliere sono energivore, assorbono molta energia e producono molta CO2, e lo stesso lavoro stiamo iniziando a farlo anche per la gestione dei rifiuti non sanitari, perché anche quello è un tema che affligge un po' le strutture ospedaliere. Quindi è più che altro una testimonianza che in diciamo, percorsi diversi sulla stessissima strategia.
Thank you. So I think this was rather a comment on my... Yeah, perfect. So thank you.
Il programma era il FESR, era il nostro programma regionale, fondo strutturale, e quindi abbiamo programmato sia nella programmazione 14-20 ma anche nell'attuale programmazione 21-27 degli interventi proprio sulle strutture, dedicate alle strutture ospedaliere, di transizione ecologica ovviamente.
Sì, questo mostra anche come l'utilizzo di strumenti diversi può funzionare, in un altro caso può essere più difficile ottenere finanziamento, perché ovviamente quando poi si tratta di un programma centrale di quelli diretti è un po' più complicato, come il programma LIFE. Are there any other questions? Otherwise, I have one, if I may, because you said that the applications unfortunately failed, so they improved significantly and they learned a lot from the first round. Are there plans to apply again, and what do you take away for the health system? What are the lessons looking forward? Can you build on that to apply for funding in the future? Are you planning to kind of institutionalize the knowledge that you learned from this project?
Yes, as I said before, unfortunately, both of the projects that we consulted in the end fell short of the receiving funds. And of course, there's this knowledge now that we build up and we trying to save, so to say. But we tried also wanted to participate in the next TSI and following project as well, and would have enjoyed to take the possibility there, and then use the knowledge more and dig deeper in that. So this is something that we are still working on to not lose what we learned and gathered in the meantime. And of course, with the change in the new MFF is of course something that we also have to consider, whether so that the knowledge and all that we collected is not lost and not necessary anymore.
Thank you, Klaus. I think if there are no further questions, we can move on to Slovenia, and I'll give the floor to Dusan.
Okay. Buenos dias. Good afternoon from my side. I'm Dusan Jošar from the Ministry of Health of Slovenia. We also participated in this first step in TSI Health Resource Hub. I have to mention that what was said before, but still the adoption of Council conclusions during Slovenian presidency was very important to launch this pilot project, because we saw that member states struggle very hard to access the EU funds, instruments, when they need them by carrying out their reforms, which are actually also directed by EU Commission through, for instance, country-specific recommendations. So we decided to put this into Council conclusions, that this assistance to navigate through this puzzle of numerous funds and instruments should be somehow assisted by the EU Commission through so-called hub, Health Resource Hub, over one-stop shop or a single point of access to support the member states in planning, financing, and implementation of changes. So these council conclusions were very successfully unanimously adopted, and then right away we started with TSI project in 2022. And when we were looking what area we should touch upon, we decided to choose primary health care. No? Okay, no. I'm sorry, this has... Okay, I think we're there. Yeah. Primary healthcare, because Slovenia has a system of gatekeeping, and primary healthcare is very important in accessibility of healthcare services. And we saw through many years that this access is hindered. A large number of people didn't have a chosen personal physician, and so this was difficulties to access other services in the secondary level. So there are many challenges. How to governance primary care, how to ensure numerous or necessary number of human resources. It is needed to mention that primary healthcare is in Slovenia in the remit of municipalities, and the secondary and tertiary level is in the remit of the state, as regards of coordination and governance. So we had to combine those two levels somehow to be more efficient. And also reorienting digitalization development, so the needs of clinicians and other careers are better considered. So in the project, we wanted to improve the access to primary healthcare through organization interventions. And this was, we chose three. This was work stream 2, because we also had work stream 1, as it was presented before, and I will describe this later. This work stream 2 was tackling Health Hub, and we wanted to improve access to primary care through organizational interventions in 3 levels, namely in creating a center of coordination and development of primary health care. Then another one was to set up the National Center for Primary Health Care, called Center for Primary Health Care. And the third one was standardization of triage procedure in primary health care. Those 3 things were also a content of drafted strategy for primary health care, which was in the preparation. And taking part in this TSI also made able to put the primary health care into the higher level on the political agenda, and also in a swifter finalizing of this strategy, because the inputs from the TSI were very valuable for the finalization of this strategy. So this was big advantage and input and yes, added value of this project. What we did, no. Oh. Okay, it's a delay, no, I see. So to improve the structure of the project, what we did in all these 3 segments was in the first one, in center of creating a center for coordination and development, was what were the good practices abroad. good approaches to setting up such center. Because the primary healthcare became a high priority, we need a good coordination, governance, and so we needed something that would do this task. So we looked abroad for good practices. Then we, of course, included and consulted the stakeholders, the medical chamber, the chamber for nursing, healthcare fund, National Institute for Public Health, and all these stakeholders were involved to create and shape the structure of this public center for developing on primary healthcare. And this was the groundwork for work on the center. The second section or second cluster in this national call center was also looking what are the good practices in Slovenia and also abroad. Because in Slovenia we had some good practices in primary healthcare centers. We have 65 primary healthcare centers in Slovenia, and this work on handling the patients is fragmented. It's fragmented, and this is not good for patients, and we needed to bring this to higher level. And so we had some good practices within Slovenia, and also good practices on handling patients outside. There were good approaches and tools how to create call center and manage calls and manage patients, and how to transfer or refer them further or handle them at this point of treatment. So we had a pilot in implementation in one healthcare center to create pilot, and then we saw what were the requirements to set up such a call center. And then the final goal is, and still it's not reached, it's establishment of the new call center on national level. We are still in the process of creating this, so yes, it's an ongoing task. And the third one is the standardization of triage procedure in primary healthcare. This was we saw the approaches in other countries. Especially there is a popular triage approach, Manchester one, and some others, and we were looking which ones would be good for Slovenia. Then the next task is the adoption of the appropriate guidelines for training the program for the staff, for workforce, how to put this triage approach into life. Then the third one is the implementation of national triage guidelines. This third one, clustered, so to say, it's still also underway. It's still working this area. So what the technical TSI did also within these activities, we did the mapping exercise to find the appropriate funds for each of these three tasks that we had in this primary healthcare development. So, for the creation of a national primary healthcare center for development and coordination, this first one is we found the solution that possible funds for this to set up such center were technical support instrument, TSI, twinning project, TIEX, EU for Health, and cohesion funds. In the area of call center, we saw digital, CEF digital, then Digital Europe, EU for Health, Horizon Europe, and also cohesion fund. And for the triage, for creating the triage guidelines, standardization procedure, and in primary healthcare, there was identified Erasmus Plus and Invest EU. So this was, it looks very simple now, but this task was, it was really complex work on this. And I have here examples of these outcomes that were provided during this project, and I can also share with you these outcomes, so you see what we found and how we came to these results. Because it's really struggling. You have to have clear goals. You have to know the structure. So to implement this reform, one reform, you know what to do, because nobody else will help you doing this. And this is very important when then applying to this European European funds. This picture doesn't show a lot. It's the documents that were also provided. So educational models for family medicine, these two brown booklets, and triage at primary level. Then in the middle, it's the EU resources for investing and strengthening health systems. And then the last one at the bottom is a mapping of existing tools for patients' requests and patients' empowerment. Yeah, that was Slovenian approach. In the work stream 1, in making the case for investment in health, we did the exercise how to make the case for investment and how to negotiate with predominantly Ministry of Health. We always had a big struggle when we are trying to get investment and funding from the national budget, for instance. Big debates with Ministry of Finance, because they always say, well, you are not efficient in this area, you are not efficient in this area, money is leaking in health. That's all true, but to fix that, it's not, you cannot reach it, you cannot make savings overnight. This is long-term run in health, and we see this because, for instance, we invested in shortening waiting times in Slovenia, waiting times in specialist care, and yes, in specialist care and in diagnostics are quite long. And then, of course, Ministry of Finance wants to see results next month. This is not possible. You need time in this, but money for investment you need right away. So this workstream 1 was the task here was how to make the case, how to make evidence-based case for investment and convince the Ministry of Health experts that this is something that has results in long term in health, and this will bring good outcomes in long term, but not tomorrow. There were also produced 2 or 3 guidebooks for ex-ante impact assessment. So you have evidence-based calculations how investment will bring the result in public health of population. So how the indicators will improve in time, of course, and this has somehow facilitated the path and paved the path for a better communication between Ministry of Finance and Slovenia and Ministry of Health, because now they see that this is not an easy way, and the leaking is always in the system. We try to fix this waste, as we call, overproduction of healthcare services and unnecessary or production of services without the indication, and also other distractions and irregularities. but the outcome, the lessons learned from this was also to include Ministry of Finance at the very beginning when we want to have the investment and what will be the outcomes, and that they better understand the Ministry of Health. The good part was in Slovenia during the mandate in 2014, 2018, when the State Secretary from Ministry of Finance became Ministry of Health. So she knew everything about the financial part, but then she learned that this is not a straightforward thing, and you cannot just look numbers and say this is here it's not efficient, you are not efficient here, and it was I think it's a good approach if somebody from Ministry of Health goes to Ministry of Finance and takes decisions there. It also helped Slovenia to position it between member states. Where are we in indicators? It was good collaboration. It was exchange of good practices and the knowledge because we were working intensively together with Belgium and Austria, and also how they think, how do we think, and how we come to solutions. Where are they more efficient in finding solutions? So I really I'm happy to hear that Italy and Spain continues work on this, and we are always there for you to help you to find if you have any questions. And as I said, we will share with you as much as you need for your work to continue, because it's our ambition to create this hub for Slovenia, at least on the EU level at the Commission, to assist member states in navigating and accessing funds when they need it, not when they are available. Because this is also discrepancy. When member states make reforms, then they face the discrepancy in availability of adequate funds. So this hub or one-stop shop will do exactly this thing. It will combine the needs of member states and the availability for them at this point of time. Because it's not helpful if you missed this year a call for, I don't know, funds, and the next year will be available, not this year. So I hope you will succeed in this, and we will help you whenever we can. Thank you.
Well, thank you very much, and where you get your, perhaps if there is any question, you can use this one. Mariella, give just a second. You got it on? Perfect. Here you go. Là.
Grazie. Allora, io volevo chiedere due cose. Innanzitutto grazie per l'esposizione, è molto interessante il progetto. Volevo chiedere, i medici dell'assistenza primaria, quindi quelli che noi in Italia chiamiamo medici di medicina generale, che tipo di rapporto contrattuale hanno in Slovenia, hanno da voi? Cioè sono dipendenti o hanno un altro tipo di rapporto di lavoro? Se è possibile sapere quanti all'incirca sono, e poi cosa avete fatto per ridurre invece le liste d'attesa sui medici specialisti? Grazie.
Waiting list is always quite an important topic. Do you want to respond now?
Yeah. In primary healthcare, we have around 1,000, but absolute numbers don't say a lot because we are a small country. We have them not enough. This is the most importantly. We are below the EU average, and we struggle how to attract them. But we have them a little bit more than 1,200. We say in teams because there are teams of family doctors with nurse and technician and so on. Contractual, they are involved, they are employees, public employees, if they are in healthcare centers. This is a public institution, which is not unique, but it's a Slovenian speciality, and it is a good heritage from the socialist times, I have to say, because they combine different specialities in one point. But then you have also the private settings, which we call concessionaires, which are included in public network, but they are then self-employed. They are liable to follow the rules of the public salary regulation. There is minimum salary set, but you can go above this. Excuse me. But of course, in public network, they follow the promotion by the law, whereas in a private setting, they can pay them more. They can pay them more, so they move from these public centers to private settings. So we struggle, we changed the law, how to increase salaries also in public network. So yeah, that's not the situation in Slovenia. And waiting times we approached here with the payment model, how to attract, how to make more production of more services possible. Payment model which is stimulating which have incentives to provide more services for people waiting. But this is also tricky because physicians can produce waiting times artificially, and so we have waiting times, waiting lists, but they are not real. They are made artificially, and excuse me. They are made artificially. So just to address the payment model, to be very stimulative, to increase the price of service is not a good approach. So you have to monitor about because we have referral system. Your family doctor refers you to a specialist. Because we have these family doctors are quite, they use defensive medicine, the medicine approach, meaning that the person says, I have pain here, I would go to a specialist. Well, they refer them to a specialist. I have a pain in my shoulder, I would need, I don't know, CT scan or something, or, and they refer them without deeper consultation and treatment. So many of these services, a lot of these, 30%, are unnecessary, which I was talking about before. So this is the production of waiting times artificially a little bit. So now we have the referrals with the emergency level, so to say. So there are urgent, 24 hours, then it is fast, then it is regular, it's 2 months, and it's 6 months. It depends on what physician, family doctor sets on a referral. So that reflects in waiting times. And we have, of course, aging population, which also adds up to waiting times, and the shortage of physician, and all these things combined are very complex to handle. Yeah.
Well, thank you very much. Another round of applause. We need to move on to Sophie. She's online, directly from Brussels.
We can't hear you. Yeah. Can you speak, Anne? Yeah. No, it's for us. That's for us.
Still not working?
We can hear you now, Anna.
Okay, thanks. So I'm Anne, not Sophie, but I guess this is, my turn to speak. So I'm Anne Soilier from the Ministry of Health in Belgium. I was also involved with Dushan and colleagues in the previous TSI project. I'm sorry not being able to be present with you in Madrid, but I had some agenda issues, but I'm very happy to be able to present online some parts of the Belgian experience. I don't know if you will share my slide or if I have to do so, but
What's easier for you, Anne? Would you like to share them, or should we?
I can try, okay?
Okay.
Just tell me.
Yes. Perfect, we can see them.
Okay, great. So I will try not to repeat too many things already said, because I'm also mindful of the time. But just as a background, really to reiterate that our motivation for this TSI project was really the observation that from one side, since the COVID pandemic, there is a shared understanding of the need to invest in health systems for more resilient and robust health systems. So this is adding additional pressure on the national governments, but at the same time, we know that there are many EU funding opportunities, but this can be hard to reach. This is a very complex landscape to navigate, and so we were really willing to strengthen our national capacities in unlocking the potential of EU funds for investing in health systems in Belgium. So I think this has been said several times now, but it's really important to keep it in mind when I will discuss our case study, because you will see this is not really a success story, but we can also learn a lot from failures and from difficulties. I will not repeat the framework of the project. You are well aware about this, but just insist once again of the various barriers that we have identified in accessing EU funds. First, at national level, we really see how time intensive and resource intensive it is to try to use EU funds for national reforms or investments. So yeah, we were clearly flagging a lack of resource at national level, but also some typically Belgian difficulties, like the fact that we are federal states, and this has many consequences on how we work together, because for EU funds, quite often, okay, there are some exceptions for cohesion fund and so on, but mainly you have to apply as a nation, as a member state, and for Belgium, it means that we have to have internal coordination with our regions and federated entities. It's also important to say that the processes to access to EU fund are really competitive and with uncertain results, which means that even if this is really time and resource intensive, the results is not secure. So you can spend many time and resources, and at the end with a very disappointing outcome. So it's also something that you have to have in mind when you start applying. So the idea of the case study was really to have a learning by doing approach. So we choose one important topic from Belgium, and we try to access some EU funds to complement national investment in this regard. So this is an image from one of the observatory reports, trying to figure out how many different funds and with different scale. And our idea to test how we can reach these funds was to choose a quite broad topic. So we wanted a broad topic, but also a topic with a very strong political support, meaning really a strategic area for Belgium that could aim for really impactful outcome. And so after internal discussion, we decided to go for integrated care. The integration of care, it's a long-run reform in Belgium, initiated in 2010 and still ongoing. I think many of you are familiar about this shift from hospitalized based care to more person-centered care, but in Belgium, the implementation of this shift is going through a pilot project. So since 2015, we have 12 pilot projects in Belgium. They are for the most part disease specifics and also focused on some regions. But now the objective of the reform will be to scale up this pilot project and really to have a population level integration of care, and also for all disease, not being disease specific anymore. So this is a massive reform, and this is a very high priority for our health minister, and it was also a high priority for the previous health minister. So we have chosen this this topic for this high engagement. The reform is articulated in 3 levels. So at the individual level, it includes patient empowerment, also trying to improve the skills of the professional, how they work together. But this has also some component at the macro level and also at the meso level. So it's this in between, like sub-regional level, where we can have also more, yeah, we can have population sharing some health characteristics, and we can have a more collective approach, public health. So the scope of the interfederal reform for integrated care was quite broad, and it was our initial intention. But then if we want to apply for some EU funds specifically, we have to be more targeted. So from this very broad reform, we had to make some choices. And after internal discussion, we have decided to focus on population health management. So this is one of the components of the integration of care at the meso level, indeed, to try to use health data to have more information about the population in this sub-regional district, trying to also improve health promotion, disease prevention, and also to involve GPs in this management. So to go further in population health management. We had to collaborate with the various regional entities and try to define together what will be the scope and what we want to do together at the national level. And in this exercise, to try to fine tune more and more and to be more and more targeted in our request, we ended to try to develop some digital dashboard enabling population health management. So really how we can share and use health data to implement population health management at the meso level. So this was the I would say the more focused outcome we wanted to develop within the TSI project, and the objective was to fund this dashboard with some EU funds, but once again, several steps were needed, and after deciding to work on a dashboard, we had to improve our expertise. We had to also identify best practices in several other regions and also internationally. So we worked on this with some experts also from WHO and other member states and with the observatory to try to define in more detail what could be this digital dashboard for population health management. We commended a research involving 3 Belgian universities and many stakeholders to try to go deeper in the concept, and we wanted to have a mock dashboard to be able to test this solution, and the objective was then to try to fund this development, the development of the dashboard. So because integration of care was so broad, we at the beginning we had many expectations about the funding opportunities. We thought that because it's digital, we can go for Digital Europe, because it's also related to the professionals and their skills. Maybe we can go for Erasmus Plus. We saw that also within Horizon Europe there is a specific partnership on transforming health systems. So maybe this could be used. We had full expectations, but I'm sorry, this is not really a success story, because all these funds have eligibility criteria, they have timeline, they have also some specific conditions, including to work with other countries or to have co-funding. And at the end, I will do the long story short, but at the end, the only funding opportunity available was the RF, because for the RF, Belgium had included one line related to digital health. So there was an opportunity, and it's quite flexible. So it was doable. But for all the other EU funds that we have explored, at the end, the outcome was negative. But we also use the funds available through the TSI to also improve expertise nationally. So it was not a total failure. We had some outcomes, but we have also learned that it's not just because you are doing something digital that you can go for Digital Europe. You have to be much more precise in your request, and the funding opportunities are much limited. And just to conclude, so some lesson that we have learned, and I think I will repeat some of the conclusion from my colleagues. I think first one was really the importance to couple some strategic vision and political support with the know-how at the administrative level. I think all this TSI project was also about this, about being aware that it's not enough to have political support, but it's important. But you also have the know-how at the administrative level. You have to have the capacities to apply. It's time and resource intensive, and so the political support is not enough. It's needed, but it's not enough, as well as the administrative know-how is not enough. So you really have to have both if you want to be successful. And also because this is so intensive in time and resource, you also have to aim big. I mean, this is not worthy if you don't go for a major reform or major investment, because you will have to being there for a long time. It's a long run. You have to involve many stakeholders. So if you want it to be worthy, you have to aim big. A third point was the importance to have really tailored support. I mean, just general information, it's not enough. You have to have direct discussion and direct contact points with the people in charge of the EU funds, or people who can really assist you. And this is also one major lesson for the hub. If a hub is implemented at the EU level, it's really important that we don't have too much restrictive condition to access. We have to have a one-stop shop who will be quite open, but where we will know the people working there, know who we can address to discuss a specific problem, because this is always very country-specific issues. And then the last point, we'll take the two last together, but the administrative burden is really, really huge. You have to be aware of this, and we are trying. We did try during the Belgian presidencies, and we continue now to trying to really reduce the administrative burden in accessing EU funds. We are public health authorities, we are public authorities. We want to access public funding from the EU. This should be easier. This is for the moment very, very complicated, and we have more and more difficulties in finding colleagues ready to go for EU project because of all the administrative burden. So we really have to do something to alleviate this if we want to continue to have some dynamic engagement from member states. What for about capacity building, the issue is also to secure some capacity at national level, but also to a longer term, because the experience from one application, even if it's not successful, can be used for a next one. But for this, you have to retain the workers, you have to retain the expertise, and so it's very important to build these capacities. And in Belgium, this is one of the main outcome from this TSI project. We really have raised awareness about this necessary long-term engagement. So we have recruited 2 persons, one really to assist our colleagues for everything related to the administrative reporting and application, all this very intensive burden. And we are also recruiting 1 person. She will start on Monday, so it's really fresh news. And she will try to have the more strategic vision about how to access EU funds. So I think it's a new example of how it's important to couple the administrative know-how with also the strategic vision. And for us in Belgium, it will be illustrated by engaging 2 person, also to have the ability to identify the good opportunities and to frame our national priorities fitting the requirement for EU funds and projects. I'm available if you have any question, just being aware that it's not so easy to understand the interpretation online, but I'm ready if you have any question. Thank you.
Thank you, Anne, and really interesting also to hear that now you're recruiting. You've just recruited someone to join you also on the strategic side. Yeah, I'm opening the floor for questions before we go into lunch, if anyone has any, or you're all very hungry. I don't see any hands going up. So thank you very much for joining us, even if from far away. It was very interesting to hear about the Belgian case study again, and yeah, just a few administrative things now. We are moving the session that was planned before lunch to the last session of the day, since we are a bit late with the agenda. And before you go into lunch, if possible, and you can sign the list at the back of the room, that would be great. And the lunch will be served in the same room as the coffee break. Thank you.